of Health, Justa Encarnacion, and also from a private organization. A presentation will be made by Dr. Julia Sheen, MPH, Executive Director of the Virgin Islands Diabetes Center for Excellence. Kidney disease is one of the fastest growing non-contagious diseases in America and also in the Virgin Islands. It's growing at an alarming rate, and it affects currently about 15% of American adults, and people of color are at a greater risk for kidney failure compared to white Americans. Black Americans are 4.2 times more likely to develop kidney failure. 9 out of 10 people with kidney disease are sometimes unaware they have it, and half of those with severely reduced kidney functions do not know they have kidney disease. About 1 in 3 adults with diabetes may have kidney disease, and diabetes is one of the top causes of kidney failure, causing nearly 45% of new cases. 1 in 5 adults with high blood pressure may also have kidney disease. High blood pressure is the second most common cause of kidney failure, causing 28% of new cases. Diabetes is a chronic disease that occurs when the pancreas does not produce enough insulin, or when the body cannot effectively use the insulin your pancreas produces. When your blood glucose is high, our people say you got sugar. Over time, high blood glucose sugar levels can damage your blood vessels and raise your risk of developing certain health conditions. Some of them are life-threatening. That's called diabetes. So it's important to begin treatment and stick with it faithfully as soon as you get diagnosis. Diabetes also leads to limb amputations and new onset blindness in adults in the Virgin Islands. Diabetes is also a major cause contributing to heart disease and stroke. And black adults are nearly twice as likely as white adults to develop type 2 diabetes. This racial disparity has been rising over the last 30 years. So at this time, we're going to do a mic check. We're going to start with the mics on St. Croix, and we'll have you just identify with your name and your position or the organization you represent. We'll start on St. Croix.
Good morning, beautiful people. Ruben Malloy, Assistant Commissioner, the Virgin Islands Department of Health.
Good morning, Janice Varmland, Deputy Commissioner, Health Promotion and Disease Prevention.
And now we'll start with Dr. Toy Hunt, and then we'll come.
Good morning, Ty Hunt Caesar, Chief Medical Officer, Virgin Islands Department of Health.
Good morning, Nicole Cragwell-Sims, Assistant Commissioner, Department of Health.
Good morning, Commissioner Justa Encarnacion, Department of Health.
Good morning, Dr. Julia Sheen, Executive Director, Virgin Islands Diabetes Center of Excellence.
Pleasant good morning, Tina Comisiong, Chief Executive Officer, Schneider Regional Medical Center.
Pleasant good morning to all the testifiers. And okay, so we will proceed. We'll start with Dr. Julia Sheen. Is it all ready? Media, you can begin. Dr. Sheen, you may proceed with your testimony.
Good morning, Honorable Senator Ray Fonseca, Chair of the Health and Hospital and Human Services Committee, Senator Kenneth L. Gittens, Vice Chair, and other members of the Health, Hospital, and Human Services Committee. I would also like to recognize Senator Novell E. Francis, Jr., Senate President, and Senator Marvin A. Blyden, Vice President, and the other members of the 35th Legislature of the U.S. Virgin Islands. Good morning to the listening and viewing audience. I am Dr. Julia Sheen, Executive Director of the Virgin Islands Diabetes Center of Excellence. Joining me today virtually is our medical director, Dr. Anthony Oliva. He's a family medicine doctor. Our endocrinologist from Howard University, Dr. Gail Noonley Bland. Our ophthalmologist, Dr. Yentin Alvin Liu. Mr. Carlos Castillo, our nurse practitioner. Shamira Robinson, registered dietitian. And new to the team, Dr. Ava Roberts, she's a podiatrist. I would like to begin today's presentation with an introduction of myself for those of you and members of our community who do not know me. I would also like to thank
Excuse me 1 second, Ms. Sheen. Dr. Sheen, I forgot to do a mic check with all of those giving testimony online and by Teams. Can we do a mic check? Make sure everyone is up and ready. We'll start with you, Carlos Castillo, and then we'll proceed.
Dr. Noonley Bland,
Dr. Tony Oliva.
Gail Nunley Bland.
Alvin Liu.
Shamira Robinson.
Is that it? I think.
maybe the others might join or maybe having problems with their mic, but I'll text them.
Okay. Okay, thank you.
There's two.
Madam Clerk, please.
Ebony Evans is on.
Okay. Madam Clerk, please mark Senator Gittins as present and give me an updated roll call. Madam Clerk, please mark Senator Gittins as present and give me an updated roll call.
Good morning again. We have 5 present, 4 excused, for a total of 9.
Thank you, Madam Clerk. We have a quorum. You may proceed with the testimony, Dr. Sheen.
I would also like to thank Governor Albert Bryan Jr. and Senator Novell Francis and Senator Ray Fonseca and the members of the 35th Legislature for including VITCO in the 2023 miscellaneous budget and for considering our request for increased funding to support our continued work in this community. Once again, just an introduction of myself. My slides aren't present.
1 second. You're expecting media to have your presentation running now?
Yes, it's
Okay,
up.
it's up.
Yes.
Okay, good.
Once again, as I mentioned, I'm Dr. Julia Sheen. I was born in Washington, D.C. and raised on the island of St. Croix. My parents are John Sheen and Angela Hodge Sheen. I come from a large delegation of Hodge, Gomez, Barry family members here on St. Thomas and Hendricks and Sheen family members on St. Croix. I'm a proud graduate of the St. Croix Central High School class of 1987, and I obtained my Bachelor's of Science degree in Management from Morgan State University and a Master's degree of Public Health from Emory University and a Doctorate of Public Health from Morgan State University. I have about 25 plus years of experience in public health, business, grants, and project management. I've had the opportunity to serve as the governor's policy advisor on health and human services. I've also served as a deputy director within the Bureau of Primary Health Care at the Health Resources and Services Administration, a branch chief within the Division of Behavioral and Public Health at HRSA, a policy advisor for the National Partnership for Action to Eliminate Health Disparities, a commissioner of health, and I've owned my own company as a grant writing professional. I would like to begin my presentation with a personal story. You see, this mission of reducing diabetes complications and improving the quality of life for people living with diabetes is a personal mission for me. My brother, Jawul Daly, was a successful engineer who died from diabetes complications at the tender age of 33. I think his death and the high prevalence of diabetes in our community underscores the need for specialized services for people at risk for or living with diabetes. At this time, I would like to provide some background on diabetes. The World Health Organization defines diabetes as a chronic metabolic disease categorized by elevated levels of blood glucose, which leads over time to serious damage to the heart, blood vessels, eyes, kidneys, and nerve. So if you answered no to any of the following questions, is your body making insulin? Is your body making enough insulin or using insulin efficiently? Then you might have diabetes and should see your private provider. Diabetes is diagnosed through a hemoglobin A1C fasting blood glucose test or an oral glucose tolerance test. And if your A1C is below 5.7, then it's considered within normal range. If it is 5.7 to 6.4, then you are a pre-diabetic. And if your A1C is 6.5 or greater, you're considered to have diabetes. So there are three main types of diabetes. And type 1, which is considered an autoimmune disorder. This is when your insulin-producing cells are destroyed. It's most common in children and adults. About 5% of the population have type 1 diabetes. Type 2 diabetes is insulin resistance, and it's more common in adults and children who are overweight. About 5,300 children and adolescents aged 10 to 19 are affected. And gestational diabetes or pregnancy-related diabetes is glucose intolerance in some pregnant women. And there are other types of diabetes that you acquire as a result of surgery, drugs, malnutrition, etc. So there are a number of symptoms associated with having diabetes. If you have frequent urination, you're very thirsty or hungry, you lose weight or have blurred vision, these are just some of the symptoms that you experience, you should see your doctor. Managing diabetes is no easy task, but if you monitor your blood sugar, you exercise, change your diet, and adhere to your medication, then you can be successful in managing your diabetes. And if you're not managing your diabetes, then these are some of the complications that you can experience: diabetes nephropathy, hypertension, problems with diabetic foot ulcers, diabetic retinopathy, cardiovascular disease, stroke, etc. Diabetes is considered a silent epidemic, and it has global, national, and local significance. The World Health Organization reported that 537 million people worldwide have diabetes, with the majority living in low and middle income countries. About 1.5 million deaths are directly attributed to diabetes each year. The global disease burden accounted for $966 billion in annual spending and 6.7 million deaths in 2021, and 643 million adults are expected to be affected by diabetes by the year 2030. In the Virgin Islands, diabetes is the leading, in the United States, diabetes is the 7th leading cause of death, affecting 38 million people with an annual cost of $412 billion. And there were estimated to be 1.2 million new cases of diabetes diagnosed in 2021. Here in the Virgin Islands, diabetes is the 6th leading cause of death, with 14.9% of our population living with diabetes compared to 12% on the mainland. The high prevalence of diabetes is particularly high because we have a high prevalence here in the Virgin Islands, because 71.4% of Virgin Islanders report consuming less than 5 servings of fruits and vegetables on a daily basis. 35% of us are obese. 57.3% of us do not engage in 30 minutes of moderate physical activity on a daily basis. And 31.8% of adults have high blood pressure. So the Virgin Islands Diabetes Center of Excellence was developed to provide support for people with diabetes. Our vision is to become a leader in diabetes education and treatment in the Virgin Islands. We are a 501c3 nonprofit organization headquartered at 4040 La Grande Princesse in Christiansted, St. Croix. Our mission is to prevent diabetes and reduce its complication through health promotion, patient education, treatment, and research. Our goal is to reduce the burden of diabetes and improve the quality of life for persons living with diabetes and those at risk for diabetes. We take a patient-centered approach to providing healthcare services for our diabetic population. We combine clinical services with education, enlisting family and friends to support our patients, and we connect our patients with community resources. We are building a multidisciplinary team to serve our patients. We now have Dr. Nunli Bland, our endocrinologist from Howard University, to see both children and adults with diabetes. An ophthalmologist, Dr. Alvin Liu from Johns Hopkins University, who will screen our patients for diabetes retinopathy. Our nurse practitioner, Mr. Carlos Casillo, who conducts diabetes head-to-toe assessments, and our medical director, Dr. Dr. Anthony Oliva, a family medicine physician, who is also our medical director, and he oversees our clinical operations. We also have Dr. Eva Roberts, who is our podiatrist, and she'll be joining us later on this year. We are building a patient-centered medical home for patients with diabetes. VITCO services consists of our rural health outreach program, where we go into the community and conduct rapid A1C testing to identify new cases of diabetes and those persons with A1Cs who are out of control. We recently purchased a telemedicine mobile unit to increase access to these types of services. VITCO's diabetes clinical services are offered in person and via telemedicine and includes consultations with specialists, the specialists I mentioned earlier. Our chronic care management services is where we follow our patients every 3 months and include them in interventions that help them control their condition. We recently held a medication management session for GVI employees, and it was well attended. We are expanding our footprint in this community with outreach education, awareness activities. Over the past 6 months, we've participated in over, I would say, 50 outreach events. We conduct monthly diabetes self-management classes, and we're getting ready to launch our Prevent Type 2 Diabetes program. VITCO's weekly schedule consists of clinical assessments and rapid A1C testing Monday through Friday from 9 to 5. We're moving to comprehensive lipid cholesterol testing in-house within the next month. The diabetes self-management classes are also offered on Monday, once a month, on Tuesdays from 4 to 6, and endocrinology services are offered on Wednesdays and Fridays. This is our target population. We will continue to target people with type 2 diabetes, and now that we're able to see children, we're seeing an increase in the number of children that we see in our clinics. VITCO staff has over 100 years of combined experience in emergency and family medicine, public health, diabetes education, nutrition, endocrinology, pharmacy, etc. This is the team that I just spoke about earlier, and some of them are on the phone. VITCO's partnership continues to grow as we continue to partner with the Department of Health, UVI, Beeston Hill Health and Wellness, and a number of partners in our community. I just wanted to share a little bit about our patient demographics with you. Since our inception, we have served 2,210 individuals with diabetes. The mass majority of those individuals have type 2 diabetes, followed by those with prediabetes, and about 1% of our population have type 1 diabetes. 68% of our patient population have high blood pressure, and 41% have high cholesterol. Nearly 80% of our patients are overweight, and about 50% of them are obese. In terms of our payer mix, you'll find that the majority of our patients are private payers as well as, or have private insurance, followed by Medicare and Medicaid. Just recently, we've seen that flip where most of our patients are Medicaid and Medicare. Just wanted to share what our diabetes continuum of care looks like as we focus on optimizing provider and multidisciplinary teams, making sure that our patients have interventions that help them control their diabetes, and we're also increasing our data infrastructure, as well as reducing health disparities. Our major focus is on improving health outcomes for our patients. These are our main objectives: reducing A1Cs greater than 7, improving dietary habits, improving physical activity, increasing access to diabetes specialists for our patients, and improving overall diabetes self-management. As of September 2024, 80% of VITCO patients showed improvements in their A1Cs, 21% had average improvement in their A1C, and patients with A1Cs greater than 7 improved from 10% to 40%. Since VITCO's inception, we've accomplished a lot. I would like to just share some high-level accomplishments with you. So as mentioned earlier, we've served 2,210 people with diabetes, over 300 people participating in our diabetes self-management classes. We are a CDC prevention recognized center. We have partnered with Howard University to provide endocrinology services, recently recruited an ophthalmologist to screen our patients for diabetes retinopathy. We're partnering with United Healthcare on health and wellness initiatives. We have participated in 50 outreach, education, and awareness activities. We applied for 4 new grants, established a referral relationship with Frederiksted Healthcare, Inc., and we're partnering with Amazon Web Services to improve our data infrastructure. We are as well partnering with the Virgin Islands University Center of Excellence in Developmental Disability to launch a 3-month mixed media campaign. We're partnering with the Division of Personnel to promote diabetes awareness for GVI employees, and we recently conducted a very successful health fair on August 24th at the UVI 13D Innovation Center on St. Thomas, where we saw over 200 people who received rapid A1Cs. They had visits with diabetes specialists and got their feet and eyes examined and participated in nutrition classes. So what's new for us? We recently launched a monthly nutrition class. We have monthly medication management classes as well. And as I mentioned earlier, we just recently launched a Prevent Type 2 Diabetes program, which is a year-long program to help people with prediabetes. We purchased a retinal imaging camera, and what's unique about this is it doesn't require any eye dilation. These are just some of the pictures from our November 24th health fair. And then I talked about our mobile van, which will be here between October and November. We're also purchasing a 6-passenger van because what we're finding is that a lot of our patients don't have transportation to access our services. And then we are incorporating remote patient monitoring for people who have diabetes that might be out of control. And then I think the most significant accomplishment for us is we are expanding our services to the island of St. Thomas, and I'd like to thank CEO Comisión for partnering with us. We're going to be located on the 5th floor in the hospital, and we should start providing services this month, later on this month, when the endocrinologist is here, the last week of October, and we're moving to a new location on St. Croix that is ADA compliant. I'd like to thank you for giving me the opportunity, and I'd like to leave you with this video. a testimonial from one of our patients.
Thank you, Dr. Julia Sheen.
And if media can play the video, that would be great.
Yes. Media, please.
Oh, yes. I'm sorry, I forgot to mention, if you'd like more information about our services, please call us at 340-208-0260. And I am so sorry, I forgot to acknowledge my esteemed colleagues here with me, Commissioner of Health and her team, as well as CEO Comisión, and the team on St. Croix as well.
Yes, and
So
that
if
number.
media can play that
Media,
video.
proceed, yes.
Hi everyone, it's me, Sharon, also known as Peachy from Peachy's Pantry. Listen, for 3 months now I've been here at VEDCO, Virgin Island Diabetes Center of Excellence, and I had started with a diabetes number A1C of 6.8, and today went down to 6.2, girl. If you have any issues with diabetes, prediabetes, anything like that, come on over to VITCO and get your numbers down.
Thank you.
Thank you, Dr. Sheen, for that video. And if anyone wants that number again for the Virgin Islands Diabetes Center for Excellence, it's 340-208-0260. Next, we'll have the Honorable Tina Justa Encarnacion, Commissioner of Health. You may proceed.
You're mixing our names up. That's
Justa
okay.
Tita Encarnacion. Yes, sorry.
Good morning. Good morning, everyone. Before I start, I want to congratulate Dr. Sheen for her work and a wonderful presentation. So thank you for that. I think that it gives a very good understanding of what diabetes is, of course, the prevention of diabetes. Good day, Honorable Senator Ray Fonseca, Chairperson of the Committee on Health, Hospital, and Human Services, Honorable Senator Kenneth L. Gittens, Vice Chair, committee members, and all non-committee members, and the viewing and listening audience. I am Justa Tita Encarnacion, Commissioner of the Virgin Islands Department of Health, and present with me today are Assistant Commissioners Dr. Nicole Cragwell Sims and Ruben Malloy, and Chief Medical Officer Ty Hunt Caesar, and Deputy Commissioners Janice Valmont to present pros and cons, if any, of granting VIRCO, the Virgin Islands Diabetes Center of Excellence, the request for public funding or other support. According to the 2023 Behavior Risk Assessment Risk Survey, the prevalence of diabetes in the USVI adult population in 2023 was 16.6%, up from 15.3% in 2022. As per the 2020 census, the population aged 18 and older were 70,030. This would suggest approximately 11,625 adults aged 18 and over have been told by a doctor they have had diabetes in 2023. The public health approach to addressing type 2 diabetes at the population level places significant attention and resources on prevention. Access to care and chronic disease burden are two of the 6 priority areas in Healthy Virgin Islands 2030, the territory's Community Health Improvement Plan. The Healthy Virgin Islands 2030 can be accessed at reports-and-plans-VI Department of Health. Public health agencies rely on a wide network of stakeholders working together as a comprehensive healthcare system to reduce the impact of chronic disease, resulting in improved health outcomes and reduced healthcare costs. The Department of Health currently receives grant funding from the Center for Disease Control and Prevention to conduct health promotion and prevention initiatives. Activities include multimedia campaigns to raise awareness and implementing evidence-based interventions to improve overall health outcomes related to chronic diseases, including diabetes. Funded solely by general fund appropriations, the VIDOH community health clinics provide primary care services regardless of the client's ability to pay and are located on all 3 islands. These clinics served 1,693 clients in 2023, of whom 123 or 7% were diagnosed with diabetes. Public-private partnerships have been a cornerstone of the work of the department. Through mutually beneficial collaborations, the Department of Health can maximize reach and overall impact while leveraging limited resources to achieve strategic and population health goals. Today, the Chronic Disease Program and the Community Health Clinics have successfully partnered with VIDCO to conduct outreach events in both districts. This type of collaboration aligns with the Department of Health central challenge as stated in our Strategic Plan 2020-2025 to make health the Virgin Islands shared value, operationalized through our strategic priorities to take health to where people live, work, learn, play, and pray. The cost benefits of preventive health care are well documented in the literature. For many, cost and access to care are significant barriers to completing routine care. The Department of Health, as a public health authority for the territory, operates with annual appropriations and a portfolio of federal grants. Each year, we find ourselves defending our budget and make a strong case for adequate funding to continue incredible work entrusted to us by our community and Governor Bryant's Healthy Rising initiative, which actually was started alongside Dr. Sheen. Therefore, we understand and appreciate the request by VIDCO to expand access to prevention and early detection services as a key partner in the comprehensive healthcare system. The department is committed to reducing health risks, increasing access to quality and equitable healthcare, and enforcing health standards. Nonprofits are dependent upon philanthropic and public sector funding. The government, on the other hand, dependent on the nonprofit sector to provide services to its constituents, very much as seen in the VI Department of Health and the VI Diabetes Center of Excellence Collaborative. Our thanks to Governor Albert Bryan Jr. and Lieutenant Governor Tregenza A. Roach for continuing to prioritize public health and the wellness of all Virgin Islanders, and support for our colleagues and support from my colleagues in the cabinet. Again, we thank this body for its commitment to public health and for the community to acknowledge our support for VIDCO to today's hearing. The department continues collaborative efforts with the 35th Legislature, all your members. We stand ready to respond to any questions you may have. Thank you, Senator.
Thank you, Commissioner Encarnacion. Next, we'll have testimony from Tina Comisión, CEO, Roy Lester Snyder Regional Medical Center, Esquire, MPH. You may proceed.
A pleasant good morning, Honorable Senator Ray Fonseca, Chairman of the Committee on Health, Hospitals, and Human Services, to other senators present, and to the listening and viewing audience. For the record, I'm Attorney Tina Comisión, Chief Executive Officer of the Schneider Regional Medical Center. I want to thank this committee for the opportunity to give testimony in support of the VI Diabetes Center of Excellence, or VIDCO. I am here today on behalf of SRMC to express support for the VIDCO and their initiatives. SRMC is dedicated to improving the health and well-being of our community, and we recognize the critical role that other healthcare providers, including VIDCO, play in raising diabetes awareness and providing essential support to patients and their families for persons who are diagnosed with diabetes and pre-diabetes. As we all know, the Virgin Islands has an aging population with a high prevalence of diabetes and pre-diabetes. VIDCO can help to expand access to diabetes education and offer other screening and preventative treatment, which will help to reduce the incidence of diabetes in the territory. VIDCO can also help to improve outcomes for patients who are living with diabetes by creating additional access to primary and specialty care providers who are trained in treating and managing diabetes. SRMC and the community will benefit if VIDCO is able to expand its programming. If there is better management of diabetes and chronic conditions in the community setting, there will be fewer emergency room visits, fewer inpatient admissions, and decreased number of patients ending up on dialysis. When diabetes is uncontrolled or untreated, persistently high sugar levels can damage nerves, blood vessels, and vital organs. Very serious health conditions such as blindness, heart disease, eye, foot, skin, mouth conditions, hearing problems, and kidney failures can occur if proper diagnosis and treatment is not available to patients. If good healthcare services are available in our community from entities like VIDCO, it will reduce the number of patients who arrive very sick at the SRMC emergency department, and it'll help to avoid more costly admissions to SRMC and longer length of stays at SRMC. Prediabetes can lead to diabetes unless steps are taken to prevent it, and we need entities like VIDCO to assist patients in our community with taking the necessary steps to prevent it. Investment in prevention and early treatment is a very good investment of our resources, as it's much less expensive to care for these conditions and these patients when these situations are addressed early. SRMC remains an advocate for the expansion of all healthcare services in the Virgin Islands, especially those providing much needed preventative and outpatient care to persons regardless of their ability to pay. Currently, SRMC is partnering with VIDCOE, or VIDCO, in their efforts to expand their services in the St. Thomas St. John district by offering special consideration on leasing clinic space for their patient visits on the 5th floor of the Royal Leicester Schneider Hospital in our newly renovated specialty clinic wing. We look forward to partnering with VIDCO on future patient care and community outreach events and education initiatives. SRMC will continue to partner with entities like VIDCO to promote access to healthcare for our community. I want to thank our hardworking team at Schneider Regional Medical Center, both our team on St. Thomas at the Royal Leicester Schneider Hospital and our team on St. John at the Myra Keating Smith Community Health Center, for all of the excellent care they provide to our community on a daily basis, 24/7, 365. We are continually working to improve in the services we provide, and it is our mission to provide high-quality care to our community. We want to encourage the public to trust SRMC with your care. At SRMC, we have a highly skilled team of well-trained and highly qualified providers that truly care about our patients, and we're supportive of the work that VIDCO is embarking on to add to the healthcare that's currently available in our community. We want to congratulate Dr. Sheen and her clinical and outreach teams on the work that they are doing. We look forward to the addition of endocrinology services through VIDCO, and we look forward to expanding our nutritional counseling services at SRMC as well. As a reminder to the listening audience, if you or someone you love start to notice new symptoms or any possible pre-diabetes or diabetes symptoms, including urinating often, feeling thirstier than usual, having blurred vision, feeling tired or fatigued, having headaches or irritability, we encourage you to contact your healthcare provider or to reach out to the VIDCO for a connection to a provider. We encourage you to come and get your lab testing done regularly. We have a very excellent lab at Schneider Regional Medical Center where we can provide testing for your sugar levels. We can do A1C testing and get you your results so you can better manage your health. If you've already been diagnosed with diabetes, we encourage you to make sure that you follow your doctor's recommendations and that you continue to receive close follow-up until your blood sugar levels stabilize. We encourage everyone listening to get healthier, eat healthier foods, get more physical activity, and lose those excess pounds to achieve better, healthier lifestyles. We can and will work together to continue to improve the treatment of diabetes in our community. This concludes my testimony, and I'm available to respond to any questions. Thank you.
Thank you, Tina Comisión. Okay, so colleagues, there you have it. We've gotten the testimony from the experts. We need to make a decision because prevention of diabetes is much cheaper to the government of the Virgin Islands then the treatment, especially if it goes to end-stage kidney disease and the amputations and the eye, et cetera, et cetera. So we're going to go to a round of 5 minutes, and we'll start with Vice President Senator Blyden. Senator Blyden, you're recognized for your 5 minutes.
Thank you, Mr. Chair, and good morning to my colleagues, the listening and viewing audience, staff, central staff. Good morning to Dr. Sheen.
Good morning, Senator.
CEO Comisión.
Good morning, Senator.
And her team, Commissioner Encarnacion and her Assistant Commissioner and the rest of the supporting team. And thank you so much for your testimonies. I must say, Dr. Sheen, in respect to data, that's a lot of data. That's a lot of good information. And I appreciate that because data drives policy and it basically assists us in everything we do. And I have a lot of questions, though, for such a short time. But nonetheless, it's a very good topic and it's a very important issue, diabetes in the territory. Let me ask you quickly, and please be succinct for your responses so I can get to the other individuals. In respect to diabetes in the territory, you gave some data in terms of the amount of individuals who have diabetes here, what the symptoms are, what types of diabetes we have here, and what the causes of diabetes. Briefly, can you speak to when it comes to diabetes in the territory? You say you have 4 new grants. What's the target of those grants? What are those grants for?
So we currently are funded with ARPA funding. So that pays for our overall operations. But as you know, ARPA funding has an expiration date. And then the other funds that we receive are very specific. There's one from HRSA that helped to purchase a lot of the equipment that we're using, the remote patient monitoring, our medical equipment, the rural health van that we have. Then we have miscellaneous funds that we received from the legislature that is administered by the Department of Health. That helps to supplement our operations as well. And then we also have funding from the USDA. And the focus of that one is more around telemedicine and technology type services.
Okay, very well. And also, CEO Encarnacion spoke to what's coming on the pipeline at the Snyder Regional Hospital. And in your testimony, spoke to the 5th floor, the nutritional counseling service at SRMC. Is yours going to be for counseling services, or is it going to be a little bit more in-depth, CEO?
Yes, Senator Blyden, thanks for the question. So we're very excited to have the VID COE VITCO team join us at Snyder Regional in providing much needed services to the public. Right now, we don't have consistent endocrinology services, and that's a provider that they will be bringing to see patients within the St. Thomas, St. John district right here. We have nutritional counseling, and so we're able to offer that service to patients. As we know, nutrition and managing what you eat is a very big part of managing your diabetes and getting your levels under control. We also have a very robust lab that's able to do testing, so we're able to have the supportive services in place. I think there are plans under VITCO that Dr. Sheen will speak to bring other specialty providers like podiatrists and other providers and work with our eye doctors to be able to offer really comprehensive care around diabetes and diabetes management and just general wellness care to the public.
And Dr. Sheen spoke to some 2,210 individuals in this community who have been served as a result of VITCO. Those numbers are staggering, and I see the importance of the service. And you spoke to CEO Encarnacion, you spoke to what it will mean for the hospital in terms of care and in terms of assisting the hospital with basically providing more space for individuals because it won't have so much individuals coming to the hospital. Speak briefly about that, please, what it means to the hospital and the government as a whole.
Sure, Senator Blyden. Great question and an excellent point. So we want to manage patients better in the community setting so that they stay healthier. And they are better controlled and better under management so that they're not presenting to the emergency room in crisis. It's much easier for us to manage these conditions proactively. And if we don't, patients will end up in the emergency room, will need to be admitted because they tend to be sicker. And then that just delays the other important emergency care we need to provide to everybody. So this will help us also to keep patients off of dialysis. We know we want to work hard to reduce the numbers of persons that are going on to hemodialysis every year, and this is a step in the right direction for that.
Okay, very well. And Commissioner Encarnacion Tita, let me ask you, in your testimony, you spoke to some 11,625 adults aged 18 and above. Mr. Chairman, I conclude, have diabetes in its territory. And you spoke to collaboration and partnership in terms of public-private partnership. What does that look like from the Department of Health perspective?
We also spoke about the lack of funding sometimes that the public health or Department of Health actually has in reference to preventive care, even though that is really our focus as well as regulatory. And so as a result of that, anyone that we can partner with, because we don't have to do it by ourselves. So anyone that we can partner with, like VIDCO, actually is going to help us to really expand access to care and improve the health care of the people in the territory.
Very well. Access, that's the word that have been used in every testimony. Access is very important. And in closing, Dr. Sheen, when it comes to access and the type of programs you have and the difference, can you tell me quickly before I wrap up, what the difference between the different type of diabetes, because you said type 2, etc. What are different type of diabetes and what can be done to assist in basically addressing those systems, manage them, etc.?
Well, I mentioned type 1 being a type of diabetes that usually you have when you're a child. It's usually diagnosed then. And about 1% of our population have type 1 diabetes. And you'll find on a national level, even here in the Virgin Islands, the majority of the people with diabetes have type 2 diabetes, right? Most of our patients have type 2 diabetes. And it's usually caused when you're overweight, you're not exercising, your dietary habits, family history, things like that. You can acquire type 2 diabetes.
And thank you for what you do, and I thank all of you for basically advocating on behalf of our people, especially when it comes to diabetes. Thank you so much, Mr. Chair, and thanks for this hearing. It's a very good and important topic. Thank you so much.
Thank you, Senator Blyden. You know, Dr. Sheen gave testimony. I think you said 80% or 60% of the people them was overweight. Well, they tell me I shouldn't use that word. I gotta say BMI, a large BMI. But we know who we're talking about. You know, that August 24th fair that you had, August of this year, down at UVI in the Innovation Center, right? I went down there. It was packed. And not only was it packed, it was packed by the normal folks you see walking around. Folks that look healthy and walking around, the same folks that you see in the supermarket, you see when you go to the movie theater. Those folks were the ones that was there in that clinic. So you can see why so many of us have diabetes and pre-diabetes. I think Commissioner Encarnacion, you had a number of the total in the community with diabetes. Can you repeat those numbers?
In 2023, 16.6%, and that is actually an increase from 2024, which was 15.3% of our total population. And we're looking at a population close to 80,000.
Well, Sir Popa, that's a lot of people with diabetes. That's over 10,000 people with diabetes or pre-diabetes. You know, so it's very serious. We have to take it serious. I wanted to ask about the retinal imaging camera. And I guess that will go to Dr. Yan Tin Lu. Give us some more details on that retinal imaging camera that you had, that you were using at the fair on August 24th.
Dr. Lu, are you still there? I know he said he had to leave at 11:15. I'm not sure that he's still on.
Dr.
Dr. Sheen, hello everyone.
Okay, great.
I'm still here.
Okay,
I'm in transit, so unfortunately I cannot come to video, but I'm happy to explain the camera. So just to give some background information, diabetic retinopathy is the leading cause of blindness in the working age population around the world. And so it's a serious problem. We also know that if we can screen these patients on a regular basis once a year and get to them early, it's really going to be beneficial in preventing irreversible blindness. And that's exactly what we did at the health fair. What we did was we purchased one of the leading retina cameras that are quite small in size, and we performed screening of these patients on site. And the idea is, once we take these photos, and I'm a trained retina specialist, will be able to read these images remotely. I'm currently in Baltimore and on the faculty of Johns Hopkins Medicine, and we'll be able to tell whether someone should get further worked up. And regarding the screening done specifically at the health fair, I have some data for everyone present as well. So at that particular health fair, we managed to perform screening for free for 40 patients with diabetes. We wanted to do more, but there was such an enthusiasm that we couldn't get to everyone. Out of these 40 patients, there was actually a high prevalence of patients who needed further workup. About 40% of them have significant pathology, both in terms of diabetic retinopathy and other blinding diseases, such as glaucoma or macular degeneration, who require further workup. So that's a testament to how important such a screening program is. And specifically for diabetic retinopathy, out of these 40 patients, 5 of them turned out to have what we call vision-threatening diabetic retinopathy, meaning they absolutely should get to a retina ophthalmologist for treatment within a month. We're in the process of figuring out the logistics, but I think the screening done at the health fair was a success, and it really demonstrates the need of this kind of program being implemented in the islands at scale.
Yeah, thank you, Doc. You got to break that down a little bit for me, right? Because, I don't have a PhD. But you said that in that clinic, there was 40 patients that got screened, and about 5 of them had something that was you would consider kind of serious. Is that what you're saying? With the eyes?
That is correct. Yes, that is correct. The way we do the screening is the patient can and will be screened at any setting, including a primary care clinic. A technician, doesn't have to be a doctor, can take a picture of the back of the eye, takes about 5 minutes or so. And these images are then uploaded to the internet for me to review remotely. Then I communicate back to Dr. Sheen's team and let them know which patients needs further workup. And yes, these are patients who I assume did not have a recent eye exam or may not know that they have these really serious eye issues. And in this small screening pilot performed at the health fair, we uncovered that this is actually quite common, and 12.5% of these patients should be seen in the near future.
Yes, thank you. And I'd like to acknowledge the presence of our chair of the Budget and Finance Committee, the Honorable Senator Donna Fred Gregory. Welcome. Morning. So you see, that's what's happening. We're receiving testimony that there are persons walking around in the Virgin Islands with serious diabetic issues that we need to address. And point of information, Senator Blyden, you're recognized for your point of information.
Thank you so much, Mr. Chair. Commissioner Encarnacion, you mentioned some 1,693 individuals visited the clinics in 2023, and you said 7%, which is 123 individuals, were diagnosed with diabetes. Do you have a further breakdown in terms of St. Thomas, St. Croix, and St. John, what those numbers are?
I could get those for you. I don't have them right away. What I can tell you is that what we did, I know for sure in St. Croix and St. Thomas, we took 48 actually of each island. And what we did is we paired them with our community health workers. And just like Dr. Sheen is indicating, looking at their A1Cs and working with them closely from a behavioral health standpoint, having them change their behavior, their A1C level is able to be reduced also at a significant level. So what Dr. Sheen is speaking about really is how we work with them, how we care for them, but how they actually change their behavior as a result of teaching and learning.
Thank you for your responses, and I look forward to seeing that data. I'm interested in seeing it. Thank you so much, Mr. Chair, for the time.
Thank you, Senator Blyden. Commissioner, just to follow up on that question, and then we're going to go to Senate President Francis. So based on those numbers that we're hearing today, where would you consider the state of diabetes in the territory? It's urgent, it's normal, above average, below average. Where would you rank the Virgin Islands, Commissioner?
I think that Dr. Sheen spoke to it as being a silent epidemic. If you look at that, it's not something that it's territory-based. It is definitely a population health issue that has to be addressed. In reference to diabetes and how many people we see, I'd actually like to have Dr. Hunt respond to that in terms of how she sees diabetes in the territory.
Dr. Hunt?
Sure, thank you. Ty Hunt Caesar, Chief Medical Officer, Department of Health. So when we look at most of the conditions or the diagnoses or the reasons why people are at the hospital or even in the outpatient chronic ambulatory facilities such as the dialysis centers, one of the most prevalent reason is from diabetes. So it really affects the entire healthcare system. And as it relates to the different types of diabetes, whether it's type 1 and type 2, it's very important to understand that while both of these conditions can be and usually are diagnosed in the youth. So while the autoimmune condition with type 1 diabetes is usually starts to develop symptoms in the youth, the type 2, which is usually occurs because of increased body mass index, so individuals who are overweight or obese and who have a sedentary lifestyle, these presentations start at a young age. So what I think is very important and critical for people to understand is that it's not important to look out for symptoms of diabetes. It's very important to continue and continuously maintain your annual visits for preventative management and care. If people from the pediatric population into adolescence and into young adults and into adulthood, if they continue to see their physician on an annual basis, on an ongoing basis, as need basis, these symptoms and signs can be picked up by physicians and your providers. And preventative strategies, nutrition, physical lifestyle modifications can be started before you even start to develop symptoms and signs of diabetes. Because by the time you actually have the signs and symptoms, you're already at a stage where you have end organ damage or damage to your heart, to your blood vessels, to your kidneys that unfortunately will require treatment rather than prevention. So that's something that is very important to understand. And the symptoms of type 1 and type 2 diabetes can be very, very different. While you might also have the signs of dehydration or other signs and symptoms that might be similar, they can be very different because of the different presentations and the different reasons for the development of actually what's happening in the body when you have the distinct features between type 1 and type 2 diabetes. So very important to stay with your healthcare provider on an annual basis or as needed so that your provider can continue to prevent and look for signs before you actually get to treatment.
Thank you, Dr. Hunt. Next, we'll go to Senate President Norville Francis. You're recognized for your 5 minutes.
Thank you very much, Mr. Chair. Good morning to you. Good morning to my colleagues, and of course, good morning to some of my favorite people here today, and thank you for this opportunity and this hearing. I must say that I'm a little bit jealous that Dr. Sheen has a whole listing of our partners here, and I see Department of Health, I see the Office of the Governor, I see UVI, Beeston Hill, and I see no place here where the legislature is being mentioned as being a partner. As head of this institution, I'm deeply disappointed in that. Because as you know, we have been a partner from the start on this, Dr. Sheen. Is that correct?
That's correct, Senator. I'm so sorry that I don't have the your emblem here on this side, but I did acknowledge the legislature in my presentation, and at the most recent fair on St. Thomas, we did have your logo as well as the Department of Health and our other partners at our most recent health fair. So I always give recognition.
You do have our logo, because I'm about to ask the executive director to make sure that you get a copy of our logo, because I want to also be recognized as one of the partners here, because it's only fair.
Yes, I agree with you 100%.
Thank you. So I think this discussion is very, very important here today, and especially in light of recent report. We got a report during our review of the Cigna Insurance and the increases associated with Cigna Insurance. We continue to hear about some of those chronic illnesses that are affecting this community. And of course, we do have an aging community, and we do have a sick community in some instance in regards to some of the numbers, the alarming numbers that we continue to see here. And of course, it's associated as well with what we're seeing with the increase in our insurance coverage here. But I wanted to have a discussion a little bit today in respect to how are we starting to make some inroads into this whole discussion. First of all, before I go to Dr. Sheen once again, I wanted to ask you, Commissioner Encarnacion, are we making any progress with the kidney, stroke, diabetes registry? Where are we with that?
We haven't made much progress on that, to be honest with you. This is something that we need to look into a little bit more carefully. I think we've been focusing on the different chronic diseases versus looking at the registry. So once the funding and looking at, I know that the diabetes registry we're obtaining funding for. Cancer registry, of course, that's up and running. But in terms of the stroke, that's one of the things on the agenda.
Okay, so yeah, we need to, because again, we continue to have these discussion in regards to data and how we're, driving and utilizing the data to drive our policies. So we need to make some progress in that. So I must commend the Department of Health and all of the entities, as well as VITCO, in terms of the work that they're doing here to bring awareness. We recently had the symposium that was mentioned by Dr. Sheen, but we also had under the DOT, the RRT here. Very recently we had the Seventh-day Adventist Church that's doing their work in advising this community about, some of the illnesses that we're confronted with. What do you see in respect to the prevention and early intervention? What is the delta? What is it that we're missing in terms of being able to continue to make this community aware of what's happening in the area of healthcare? We'll probably start with Dr. Sheen, and then we'll go to the Commissioner of Health.
Sure. I think that what we're missing is greater collaboration. I know we have been trying our best to reach out to not only the health centers, but we were a partner with the Seventh-day Adventists when they had their health fair just recently. We were there all days of the fair. But I do think that we need to have more of a closer collaborative relationship with all agencies, health centers, everybody coming together. I think we need to work together to develop some sort of strategic plan for the territory on diabetes. And in that plan, we would outline roles and responsibilities. But I think unless we come up with some sort of an action plan for everybody to be working towards addressing this issue, we won't really be able to see us move the needle on reducing the prevalence of diabetes in the territory.
Commissioner Encarnacion?
Thank you. We actually started a non-communicable diseases statement plan and strategic plan. Senator, may I continue?
Yes, yes.
And strategic plan. So what Dr. Sheen is asking for, you're getting it,
Okay,
which is good. It's hard to say that we're going to do a plan for each chronic disease or non-communicable diseases, but looking at it from a perspective, I think it's really important. You speak about collaboration, and I'm also going to add communication because I think that's definitely warranted. One of the other things I think we fail to do is look at chronic illness as being something that is caused by behavioral health issues. And so I'm actually going to ask Dr. Sims to speak a little bit more about how we can look at changing behaviors and affecting chronic disease. Dr. Sims?
Thank you, Commissioner. Good morning. Nicole Cragwell Sims, Assistant Commissioner, Department of Health. To dovetail on everything that was said, all of the actual and tangible steps are amazing. However, acceptance and having persons truly understand what is happening is a key factor. Nothing is going to move until the community accepts. You have a little sugar can no longer be accepted. It can no longer be something that we glance over. So having persons understand and break through some of the stigmas that are associated with chronic disease is a key factor. And the Department of Health, along with the partnerships, have always put those behaviors, those changes, that acceptance first. And so we're going to actually see persons, really accepting what the words mean and the further behaviors to change to get them done. And I think we'll really be able to make an impact at that time.
And I'd also like to reiterate that the Healthy Virginia 2030 speaks to the plans that we put in place based on the health assessment that was done. And I will go back and say that you can find it at reports and plans.vi Department of Health. Thank you, sir.
Thank you. Thank you for your response. Mr. Chair, I have two additional questions, if you allow me.
Yes, you may proceed.
Thank you. And I also want to take this opportunity to commend CEO Commission also for joining this very important partnership and certainly for doing their part in providing some additional space there. But I wanted to ask in regards to poverty. We heard the conversation where perhaps about 30% of our community is in poverty. Is there any association in regards to poverty and diabetes? Any connection being made there?
Very clearly, and that is one of the things is what they eat, what we can afford to eat, and how, and also not just poverty, but it actually is historic. So my parents weren't able to afford something, so this is what they gave me to eat. So now I know exactly what I need to eat. May not be the healthiest of things, but that's really, I can afford this, and then I can save the money from here to actually buy an expensive pair of shoes, which what is the priority is also, it's not just poverty, but it's the thought process, what you feel your priority should be. So it's a combination of things, but yes, poverty has a lot to do with it as well.
Thank you for that. My final question, of course, what you're saying is stay away from the cameo cookie and take an apple.
Yes.
But my final question is in respect to education. How are we engaging our schools in this discussion as we move forward in regards to some of the chronic illnesses that we're seeing, but in particular, we're discussing diabetes here today. How are we engaging our schools in that respect?
If I may start, and then I'll turn it over to Dr. Sheen. Our MCH division actually works very closely with the schools. Last year, actually, and this year as well, we did the diabetes walk. And the diabetes walk wasn't just a walk. It was really teaching the young people, the young ones, how to dance, how to laugh, how to learn at the same time. And that day after that, I actually spoke to two of the staff members. Actually, Dr. Hunt was one of them, and Dr. Esther Ellis was another, and asked what did their children get out of that. And their children were able, not just because they're children of doctors, but they were able to actually speak about the walk and speak about what diabetes actually mean and what some of the things that they have to do to make a difference. We go into the schools as well. And going back to what Dr. Sin spoke about, we have a lot of discussions about what they see and how they feel about themselves. That has a lot of impact in what they do also.
Can I respond to that as well?
Yes,
Okay,
you may
great.
respond.
So as part of our strategic plan, we developed a Future Fit summer camp. We plan to launch that next year summer, but we developed a framework for a summer camp that will target children, not just those with diabetes, but those that are at risk for diabetes. So children that are obese, overweight. And so we are going to be working with the school system, targeting children that are in the 4th and 5th grade, because we know that if we intervene at a very young age, then to Dr. Caesar's point, if you intervene at a very young age, then you'll be able to change behaviors if you work with not only the children, but with their parents. And so that's our plan for the upcoming year.
Thank you.
Thank you very much, Mr. Chair. Thank you for the responses. Mr. Chair, very good discussion here today. I appreciate it.
Thank you, Senator Francis. Dr. Michelle Adams, dietitian. You know, we're talking about the eating habits. You know, sometimes it's real hard, you know. I just last night, for example, I had some meat and some, you know, rice and thing. But you know what I really wanted was a 2-pack of Cameo cookies. So I end up eating the 2-pack of Cameo cookies. I ain't even finished with the meat and stuff. So discuss for us the diet. And sometimes it's hard to eat the right stuff, you know. Discuss that for us. Give us some advice, Dr. Adams.
So this is Dr. Julia Sheen. We have Mrs. Shamara Robinson on the line, so she should be able to.
Shamara Robinson, dietitian, yes.
Hello. Yes, I absolutely love that point. And I am with you. Even though I am a dietitian, there are times when I absolutely want cookies instead of what's going on. So I think our approach is all about being realistic and focusing on where each person is starting from and where we want them to get. So if someone is starting from a place where they are having a lot of sweets or are having a lot of like sodas, things like that, we slowly take steps to say, okay, how can we bring that down? Or how can we make some swaps instead of saying, oh, you have to stop everything. You can never have your cookies again. You can never have your soda again. You can never have these things. And I think that's the thing that scares people, is because when we start to talk about healthy eating and what it means to eat to make some changes for your health and for your diabetes, usually people typically take the approach of, oh, these are the things that you can never have. If you want to be healthy, you can't have these things ever again. And when people hear that, what do? They start to tune you out. They won't listen. They won't make those changes. So instead of doing that, we really do work with each person to see where they're starting from and how we make small steps. So for you, if you wanted your cookies that day, we can have them that day. But then we would talk about, okay, moving forward, what does this look like for you and how do we make some small changes to move forward?
Thank you for that advice, because sometimes, you know, you'd have a craving for the sugar, you know, and you know, so that's good. Next we'll have Senator Diane Capehart. Diane Capehart, Senator, you're recognized for your 5 minutes.
Thank you, Mr. Chair. I'd like to say good day to my colleagues, good day to the people of the Virgin Islands and the team that's here before us that is giving a very well-needed, this is education and outreach for us. So I'm pretty alarmed to hear the numbers of 11,625 individuals in 2023. That means we need to do more to educate our population. One thing I've known is individuals who are pregnant that never had diabetes. And in the presentation provided today, where it says types of diabetes, how can a pregnant woman who has never had diabetes prevent or avoid getting diabetes because gestational diabetes is something that happens when individuals never had it and then they get it. Is there any kind of prevention for those?
Dr. Han?
Tyhon Caesar, Chief Medical Officer, Department of Health. So when someone becomes pregnant, because their body changes and they become at risk for certain conditions such as diabetes, unfortunately, it's the same sort of prevention. The same risks happen as it relates to type 2 diabetes and gestational diabetes. So the risks are going to be obesity and the lifestyle. So a poor or a diet that is not recommended for the healthy plate that the nutritionist was just alluding to, and also lifestyle or so exercise, the way that we're moving. So the exercise is, of course, still recommended during pregnancy, and prevention would be to prevent or to have a healthy diet before pregnancy and during pregnancy. So unfortunately, we see a lot of we allow a lot of behaviors to be a little bit forgiving during pregnancy, like, oh, she's pregnant, she should eat for two, and that's not the case. That absolutely is not the case. You should maintain an appropriate healthy diet for that would not be too much sugary or fat based. It should be the normal healthy recommendations, which has been outlined by the USDA and other organizations that tells you exactly what the portions of certain components in your diet should be. So the prevention is just the same, to maintain a healthy diet and a healthy lifestyle with exercise, the recommended exercise that is recommended for individuals in all individuals, pregnant and non-pregnant.
Thank you for that. Dr. Sheen, in your presentation that you provided, diabetes and the USVI, you said, problem statement, managing diabetes is a significant public health challenge in the Virgin Islands. Now, there are, as my colleague asked about that population of individuals that are more likely based on poor diet, I wanted to find out if one of the partners that can be included is human services, and I say that to say that individuals who receive public assistance to get food stamp assistance, and when they purchase foods, are not the best choices, right? So how can we work with these individuals to educate them? Because I cringe when I see some of these shopping carts filled with sugary drinks and sweets. It's not being replaced to the servings of fruits and vegetables that you should be consuming on a daily basis. Is Human Services one of your partners, if you're not working with, to work with them, to work with their population of individuals who receive assistance, to educate them? When you go to the supermarket, these are the suggested things and not this, because this could be the cause of this would lead to diabetes. Is Human Services one of those partners?
One of our partners is the Medicaid program and working with that patient population. But I do agree with you that we do need to expand our partnership to include Human Services, not only in terms of their target population, but they have a number of services that our patients could take advantage of. So that is something that I will add to my list of priorities.
Senator Caper, if I may. This is Commissioner
Yes, please.
Commissioner Kernstein and the USVA Department of Health. If I may, one of the programs that we have is the special supplemental nutrition program for women's infants and children. And Dr. Vermont is here, she could speak more to that. But that program actually teaches mothers, family members in terms of nutrition, and a lot of those supplements are linked to what Human Services are able to provide as well. So that's one of the biggest collaboration that we have in regards to women and children.
Thank you. I'm glad to hear Medicaid is one of the stakeholders because that prevention is good to minimize the cost of Medicaid, addressing diabetes in the territory. Mr. Chair, thank you for the time.
Thank you, Senator Capehart. And to follow up on that, there's a certain time of the month and thing, I think it's like in the beginning of the month, I see some shopping cart that be full pooper. I look at mine and mine barely got anything in it, but they got shopping cart full, but they full of cereal and soft drinks and all of these things. So let me ask another follow-up. The nutrition counseling, right? Give us an idea of what was given in the course that you had on August the 24th. What kind of information you provided?
I'd like Ms. Robinson to respond to that.
Absolutely. So the focus of the nutrition class that we had on the 24th was really around building a balanced plate. We talk about these things and a lot of changes can happen when people are just aware of how different foods affects their blood sugar or affects their blood pressure. So we went through and talked about ideally what a balanced plate would look like, and that's based off the diabetes plate method. So half of that plate being your non-starchy vegetables, half of that plate being your carbohydrate, a quarter of that plate being your carbohydrate foods, and then the last quarter of that plate being your high quality protein foods. So we talked about each of those food groups and what's included in each of those food groups. And it was helpful because in talking about, okay, what's a non-starchy vegetable? What's a starchy vegetable? What is considered protein? People were able to realize that foods that they thought might not affect their blood sugar actually has a big effect on their blood sugar. And so we went through different exercises of, okay, let's say you have this plate. How could you bring more balance? Using all of those foods that are culturally familiar, things that we eat on a regular basis, and they were able to walk away with strategies to build a more balanced plate, but then also talk amongst themselves about different tips they use. They're like, oh, I usually do this thing, or when I go out to eat, instead of eating it all right there, I'll split it and take some to go so then I can have 2 meals instead of one. So yeah, we went through a balanced plate, how to make changes to your plate, and then talked about the food groups and how those food groups impact your body as it relates to your blood sugar.
And one other question, because what really scares me is if you have the limb amputations, the leg amputation. So give us an idea, why does diabetes lead to leg amputations? Why they gotta go that far with the disease?
Ty Hunt Caesar, Chief Medical Officer, Department of Health. So diabetes, what happens is when you have the destruction of insulin and you have the buildup of glucose or the sugar, it remains within your blood vessels. And that's not where it needs to be. It needs to be absorbed so that it can go to the different organs for energy and nutrition, etc. But when it stays in the blood vessels, it becomes toxic and it starts to damage the blood vessel linings. And it can cause damage that can lead to decreased blood flow to certain areas. And it can then cause damage, infections, and just poor circulation. And that's when it can just chronically, when it happens too much, it gets to a point where there's lack of blood flow, there's lack of nutrition, there's lack of oxygen that gets there because the blood vessels are no longer functioning properly. And then it just causes tissue damage. And when it causes tissue damage, it gets to a point where it may not, the skin, the muscles, everything can be damaged. And then unfortunately, even the bones. So once it gets to the bones, the way that you treat an infection or the way that you treat dead tissue is to remove it. And unfortunately, if that is the case, and you have to have the limb amputation to save the rest of the extremity. So that's sort of like just in a nutshell as to why it happens. But we always try to prevent that with treating the area, trying to treat and manage the diabetes as best as possible because it's always the root cause. But when it gets to that point, again, it is really, really beyond the best that we can do. And unfortunately, the complications can continue to happen. That's happening at that limb. But you can imagine what else is happening at the level of the kidneys. You can imagine what's happening at the level of the heart. You can imagine what's happening to the blood vessels in the brain, to the eyes. Everything is happening. So at that point, it is really unfortunate because, you know, we're more salvaging and trying to just preserve quality of life at that point.
And Senator, I'd
Yes,
like
go ahead.
Dr. Ava Roberts, who's our podiatrist, she's online. She can respond as well.
Yes, Dr. Roberts. And also, Dr. Roberts, if you can add for the loved ones of someone who may have diabetes and they don't know, tell us some of the signs that we can look for in our loved ones to maybe encourage them to go to you.
Dr. Roberts?
Dr. Roberts?
We can't hear you if you're speaking.
Well, you could join in. I don't know if Dr. Hunt could answer that question. Some of the signs that a loved one can look for before you get to an amputation of a leg and stuff like that.
Sure. Ty Hunt Caesar, Chief Medical Officer, Department of Health. It's part of any diabetic examination and care from any primary care doctor and for persons who have diabetes to really look at their feet very carefully for any signs of damage that they might not notice or feel. Because what happens is because of damage to that area, it can also damage the nerves. So a lot of diabetics or people living with diabetes, I should say, they unfortunately, because they lose that sensation, they are susceptible to more damage to very simple things. Like if you knock your toe on the side of the bed, you feel it, you're like, ouch. And then you look down and you see it's purple, it's red. You put a little bit more attention to that. Some people living with diabetes don't actually have that luxury of feeling it. So they might not know that there's damage to their feet, and then they don't provide the self-care, and that unfortunately continues to happen. So what they need to do is look very carefully. Take a look, make sure they haven't stepped on any things that might have cut and pierced their feet. And also the toenails are very important to also always look at and trim because you can have damage because of non-trimmed toenails, as well as other things that might actually get under the nail beds because of the nails being too long. So just making sure that they're looking for any damage and keeping it as hygienic as possible. So if you see any signs of any open sores or any discoloration, that is when you should really seek care and go to your primary care doctor, have them examined, or even go to the podiatrist, get a referral to the podiatrist so that they can actually also help you, teach you how to actually care for your feet, because some people actually don't know exactly what to do. But it's just very important to always give attention and look. And it's part of every primary care's responsibility for anyone living with diabetes who they're caring for to always examine their feet to look for any signs of damage that the patients may not have noticed because of nerve damage or what we call diabetic neuropathy.
Senator Donna Fred Gregory, Senator Gittins, I'm sorry. I was looking for you, you wasn't there, but Senator Gittins, you're recognized for your 5 minutes.
I'll yield to the senator. Go ahead, I'll yield.
Senator Gittins, you're up next. But in the meantime, you know,
I will yield.
this last couple weeks, right, I was washing clothes, you know, it was in the night, right? And I saw this one guy had a little pan and another guy had his foot in the pan, and I was kind of interested to see what was going on. I walked over, right? And the guy foot, it had looked sick to me, right? It was like scaly, and the nails them was like almost falling off, and the guy was rubbing the foot, and it had something was, you know, nice smell like a menthol or something like that. And I was asking him, I said, well, what are you doing? You know, he said, well, I get a little blow. He's a carpenter here, and my foot. And so I say how long it is, because the foot was big, swollen. He said it was about 2 weeks ago. And I saying to myself, because I don't want to get in any trouble, I said, wow, 2 weeks ago and that foot swelled big. But there must be a reason why people don't go and get treatment. There's a misinformation that if your foot is swollen like that, you can get a rub down and it will come down, or it's too cost prohibitive. Why don't our community in this situation go and receive treatment? It was obviously a serious injury. Commissioner?
Hussein Encarnacion, Commissioner of VA Department of Health. I would say that's something that's worldwide, especially for men. Really just not wanting to know the truth. That sometimes the truth is really what saves your lives. But that's one of the things. Fear is one of the other things. Cost is another. We really and truly, we struggle with insurance here within the VI, depending on who you are, who you work for, and your age group. And so those are some of the things that we have to take into consideration as well. And really and truly just culture. A lot of times we treat ourselves with homeopathic, and it's not that it's bad, because we actually had a very successful talk just a couple weeks ago looking at traditional medicine and homeopathic medicine and how you can actually use them together. So that's healthy. But sometimes you tend to use solely homeopathic medicine and not look for what the really cause is. And sometimes looking at the cause can actually provide you with more information on how you can actually treat.
Mm-hmm. But Tina, those patients or people with those type of illnesses, they can just present to the emergency room and they'll get treatment, right?
I think any patient or community member that has a significant concern or an emergency condition can certainly report to the emergency room and we would assess and treat. But we want to encourage folks to assess how they're using the ER so that the ER can serve its main purpose, which is to treat patients that have emergent or urgent or very significant challenges that can't be addressed through their outpatient providers. So for the situation that you're talking about, I think at an earlier point in the process, recognizing I should have somebody look at this. Let me go in to see my doctor, and scheduling an appointment with their doctor and having their doctor take the first look is probably the more appropriate way to handle that situation. Going to one of the clinics, let's say if you can't get in with a doctor, going to a clinic, that may be a better option than using the emergency room resources in that way. Certainly if you get to a point where it's gotten really bad and you have no one else to look at it and there's no one else open and you need care, we're always open to do that assessment and treatment, but we ask the community to use those resources wisely.
Yes, and hence the need for the Virgin Islands Diabetic Center for Excellence. Senator Gittins, you're recognized for your 5 minutes.
Thank you, Mr. Chair, and good afternoon to all. This is certainly an important topic, and frankly speaking, every beginning of the month, when I walk into a supermarket, I'm often reminded of this topic. And I continue to say that there's a need for us to continue to prioritize education on this diabetes topic. When you go into the stores on the first of the month, at the beginning of the month, you should see the items in these carts being picked up for our children. With all the amount of sweets and whatnot, it is truly concerning, because at a younger age, they don't understand what they're doing to themselves. As they get older, they're not as active. Maybe they're looking at it that they run it off, utilizing their energy and whatnot. But as you get older, you just get into the liking of all these sweets. But let me get back to the information that was provided by the Department of Health. According to your testimony, the prevalence of diabetes has increased locally from 2022 to 2023. Do we have any statistics regarding what kind of impact that the VA Diabetes Center of Excellence may or may not be having on St. Croix?
That question for Dr.
Department of Health.
Oh, okay. So one of the things that we spoke about, and I apologize, Justa Encarnacion, Commissioner, Department of Health. One of the things that we spoke about is the collaboration. So the impact of the center is actually going to be expansion of services, cross collaboration, which is important. Looking at the numbers that we have. So data is one of the biggest impacts that I could see as well. If you whatever you measure, you can actually improve. And so looking at the numbers that we have throughout the territory, someone asked, I think it was Senator Francis asked, Senator Blyden asked, what numbers are we looking at? Dr. Valmont, who's on St. Croix, actually has those numbers and could speak to those numbers as well from a Department of Health standpoint. So really and truly increase of data, action as well, and of course reduction of care as well. Reduction of diabetes and increased care is what I see the impact going to be.
And again, I'm always calling for more public service announcements. And the Department of Health, I did see there's a commercial that you have playing and whatnot, and thank you for that. But again, we need to continue these types of PSAs so that people could have an understanding. There's a difference between diet and diabetes, and emphasizing on the poor eating habits, especially within our young people. I'm thinking back and when I was in school, elementary school, and you're in health class and whatnot, you're hearing all of this, but sometimes the teaching is way over your head and you just ain't understanding it. You need to bring it home where people understand that what you put in your body is how you're going to actually grow, or how it's going to affect your health later on. So again, I applaud you for that, but I want to continue to encourage you on doing those types of PSAs so that there could be an understanding amongst young people. Now, are there any new medications having an impact on the number of individuals needing diabetes care here in the territory?
Yes, we have, well, one thing I wanted to mention, Senator, that we are getting ready to launch 3 PSAs in November. One that focuses on diabetes complications, the other on reading food labels. We're actually doing a supermarket walkthrough. And then the last would be on diabetes and exercise. And I believe we have, I'd like to apologize for Dr. Ava Roberts. She is on, but she's having technical difficulties with her mic. But we should have on the line Dr. Ebony Evans, who is our pharmacist, and she teaches our monthly diabetes medication management classes. I'm hoping she's there and can respond to that question.
Time.
Dr. Evans, are you on?
So and as time has called, because she can comment on the chair's time, I just want to encourage both of you to at least, when you're doing your next commercial or PSA, whatever, one especially that has a visual, just like how you have the 2 young ladies going up to the van and ordering the chicken leg and the this and the that. I'd like to see you all do something in the supermarkets where, again, parents and public assistance that's going into the stores the first of the month, the beginning of the month, whenever it is, that they pick up things that are healthy for their children to eat. Instead of picking up all the whole bunch of chubbies and the sweets that's just deteriorating our young people. Even some of us as adults. But I'm asking you all to do something, connect it to the community so that there can be a connection and people will understand exactly what it is you're trying to get across. But thank you for all that you do to try to keep our community educated on this topic as well. Thank you, Mr. Chair, and thank you to the testifiers.
Thank you, Vice Chair Gittins. Dr. Sheen, I wanted to ask you a question here with this chart here, section 3, diabetes, burden diabetes around the world. You know, I was particularly looking at the continent of Africa and comparing it with North America and the Caribbean, which way in North America and the Caribbean. And it's so amazing that in Africa, the level of diabetes is the lowest in the world, and you figure those are Africans. Why is it that the Africans' level of diabetes is so low? You know, you tend to, you know, we're given statistics here about Black Americans, it's much higher than white. Why is Africa so low with diabetes?
And that's a good question, Senator. I didn't do my research to determine why their prevalence is much lower compared to other parts, but that's something I can look into and get back to you.
You'll get back to me. Okay, thank you. Senator Donna Fred Gregory, you're recognized for your 5 minutes.
Thank you, Mr. Chair, and good afternoon to the testifiers.
Good afternoon.
And good afternoon to the listening and viewing audience. So I want to shift the conversation just a little bit around how do we support this work. I think, you know, we know the challenges, we know how we eat in the territory, and we know there's a lot of work around prevention. There's no doubt that when we look at our Cigna program, when we look at the work that's being done at the Department of Health, when you go to your primary care doctor, et cetera, there's just a lot of conversation and a lot of work around it. I think the deeper question is, how do we support this work? So let me start by asking, is there an opportunity to apply for federal funds, whether it be through a public-private partnership, through a private or just public? How can we, and when I say private, I mean nonprofit, et cetera, how can we collaborate to support this work through the application of federal funds?
I will say that we've been very vigilant in applying for federal funds. We have acquired some new grants, but grants have very specific purposes. And so we are already in the process of applying for grants from different agencies, CDC, HRSA, USDA, a number of grants. But of course, every grant will support something very different. And a lot of grants won't necessarily support the overall operations, the diabetes education, which is very critical, some of our clinical services, things like that.
Okay, so I'm more trying to get, how do we collaborate? How do we collaborate with our government and our nonprofits who are willing to do this work? That's what I'm trying to...
If I may, we actually had an excellent grant writing or grant management class for our staff a few weeks ago. And one of the things that we looked at is subgrants. And we can have subgrants through using nonprofits. And actually, that's one of the benefits of it. And so we're learning a little bit more now how to make it easier, because in the past, you've been reluctant to use subgrants because of the contractual process, but that's getting better for us, and we have to take that risk to do it. So that's something that we're going to be doing a little bit more now, encouraging, inviting nonprofits with us to make a difference.
I think that's very important to this work. And then, Commissioner Encarnacion, you spoke specifically about the Healthy Horizon Initiative. And let me just, before I ask the question, is that the same thing as the 2030, the Healthy VI 2030 initiative?
The Healthy Virginia's 2030 initiative is actually a result of the CHIP, or the Community Health Assessment and Community Health Improvement Plan.
Okay.
So that's the wording that we gave to it.
Okay, and then the other one?
The Healthy Horizons, actually that is something that came out of the governor's office, linked with the policy advisor at that point in time.
Okay, and
This young lady was part of that, yes.
Okay, I asked a question for a reason. So I note specifically in your testimony, you made reference to the fact that you defend your budget. And we know that as your budget came before the institution this year, it was cut significantly. Where in your numbers or your contemplation around your budget, is there funding or were there recommended funding for the Healthy Horizon initiative?
That more goes into our chronic disease and our reduction of illness improvement process, and that's community health as well. So that's where we would put that.
So you have
We have a segment for community health, but the funding there is all in general funds. I can't say exactly how much, and I don't have Tatia with me today, but how much money we asked for that. But that is also a part of our line
How much
budget.
money came down in the executive budget, or how much money you testified here? Which one?
Both. I don't have that in front of me. I don't have anything in front of me right now.
All right, so this is what I'll say on the record, that one of the things that we did is your budget was cut significantly and we increased it. So your Healthy Horizon initiative, you should be able to cover that in your
Thank you.
your FY25 budget. So let's talk St. John for a minute. So as I traverse the island of St. John, which is part of the St. Thomas St. John district, of course, I've run into young people. There's a very young woman in particular that I've met who has diabetes and who's dependent on, help me.
Insulin?
No, she's a little further than that.
Time. Dialysis?
Dialysis, yes. And I've met a couple of other people on St. John who has to come down to St. Thomas for dialysis. And we've had this discussion, but I don't know that when we walk away from the conversation, how are we really looking at how many diabetes patients do we have in St. John that are on dialysis? Do we know?
I think we have
Can I
4
continue,
now.
Mr. Chair?
Yes, you may continue.
We generally have 2 to 3 at times, but there's 2 presently that I'm aware of on St. John that come to St. Thomas to RLSH for dialysis treatment. I'm not sure how many go to CKC.
Okay, so it's more than 2 people.
Some go to CKC.
So the concern is always how can we support the patients in St. John, and we know what the challenges are. It's the resources, and the resources more than anything else is the manpower resource. So how can we support the patients in St. John without them having to come to St. Thomas? That is the primary concern.
Well, you spoke about one of them, and that is, of course, looking at what our budget looks like from a GVI perspective, but also grants. And so we are, expanding Morris Castro.
Okay.
We did get permission from SHPO to do the expansion, and we can share with you how that's going to look, but it actually allows us to expand the infrastructure, but along with the infrastructure, we have to expand our human resources in that area as well. So one of the things that we've done is hired a health strategist, focusing also on how we can improve our health equity. And she is actually helping us look for grants that supports funding for human resources. And we've been successful so far in doing so. We just have to continue. And then make St. John a priority, ensuring that we put the people in St. John that needs to be there.
I'm glad that you said that because it's really a health equity issue. And it's very unfortunate that our people have to traverse, especially when they come off of dialysis or they end their dialysis. They're weak, they have to drive back. It's a lot of challenges, and it's truly a health equity issue. But Mr. Chair, can you allow me to wrap up? I have one
Yes,
more.
you may wrap
And
up.
that's around the conversation that I heard earlier or in the testimony of, I want to say, CEO Commission. That is tied to Roy Snyder Medical Center and the opportunity to partner with VID-COE. Tell me what it is, what do you call it? VIDCO. Okay, so you talked about leasing space and the opportunity to have patients visit on the 5th floor, et cetera. How would that look, and how would we fund something like this program, and how will this program truly benefit the community, and how would it be different from what we currently have in place? That's a lot. That's a mouthful.
That's okay. I can start. Thank you, Senator Fred Gregory, for the question. Tina Comisión, CEO for Schneider Regional. So on the 5th floor of the hospital, we've renovated some space that had previously been used for inpatient beds and some office spaces to be able to accommodate some much-needed outpatient services for the community. One of the things that we've put up there is our new GI clinic, where we're doing important screening for GI cancers. We also have a little bit of infusion services that are available up there. And we identified space. Sure, we identified space within that upfitted unit to be able to accommodate additional services. And when Vidco reached out, we definitely saw alignment in terms of what they're trying to do and patients they're trying to treat, specialists that they're trying to bring that don't currently exist. And we saw how important that was for the community. So we worked with them to identify some locations there where when they have, for example, the endocrinologist visiting the territory, they could come on site and see patients right there, where they could bring their ophthalmologist, where they could bring the podiatrist and do special clinic visits for patients in a convenient location. As you know, everybody knows where the hospital is. It's convenient to get there on the bus routes. There's public transportation available, et cetera. And there's a lot of supportive medical services right there. So we thought it was a natural fit. And we wanted to encourage and support the good work that they're doing. And so Dr. Sheen and I collaborated on making that happen. We're happy to announce that a lot of the space has already been prepared. And we think as soon as the end of this month into the beginning of next month, patients will be able to be seen in that location.
Well, thank you for that. Mr. Chair, let me just wrap up by asking.
Yes.
And then I'll put the mic down, I promise you. Let me just wrap up by asking Commissioner Encarnacion, based on what we currently provide in the territory, what's your perspective on this particular partnership? And I'll listen. Thank you, Mr. Chair.
I think it's excellent looking at a collaboration and how we can actually, I go back to say, none of us can do it alone. In order for us to do it and do it well, we have to do it together. So any collaboration and reducing chronic disease burden within the territory, I support.
Yes, thank you, Senator Fred Gregory. Those are some important questions because, funding decisions, the Budget and Finance Committee has competing priorities, and it's always important that we hear the testimony and we provide the justification. Senator Gittins, you're recognized for your point of information. Senator Gittins.
Thank you, Mr. Chair. As we're here having this discussion, I'm quickly reminded by someone viewing these proceedings that we are literally eating ourselves to death in some instances. And when I look up under the American Heart Association, it said that adult males, our sugar intake, there's a limit of some 36 grams of sugar, which is 9 teaspoons and 150 calories. And for women, the daily sugar intake limit is somewhere around 25 grams, which is 6 teaspoons or 100 calories. But thank goodness I don't drink Vitamalt anymore, because as I look up the nutritional facts for Vitamalt, it contains between 46 and 50 grams of sugar with a total of 220 calories. So again, we need to look at these things, and in your PSAs, ask people, let them know what the daily sugar intake should be, and show them. We have to educate them, show them to start reading the labels to see. And if they've had one beverage for the day, then you don't need a second one again following. So I'm just asking, I just brought this up so that as we're doing the PSAs, again, I want you to be able to truly connect it with the community so that even the youngest that's looking at it can understand exactly what it is you're trying to get across. Education, in this case, will be the key. Thank you so much.
And
Yes. 40 grams of calories. Well, Sapopa. What can we drink? Senator Novell has a point of information, and then Senator Fred Gregory. What can we drink other than a Vitamalt? What would be a suggested replacement drink? Because
Water.
Vitamalt is water.
Yes.
Water. Okay, Senator Novell Francis, you're recognized for your point of information.
Thank you very much, Mr. Chair. I got a similar concern, similar text. I guess it's important that we continue to educate the public in respect to at least the daily intake of sugar as well as salt and everything else. But I wanted to take this opportunity to ask the Commissioner of Health, do we have a nutritionist on board or a registered dietitian?
We do have a nutritionist in our WIC program, so we start from early, and that's where the conversation begins. We also have nurse practitioners who are trained also to teach, and so one on each island, as well as nurse practitioners and physicians and nurses.
And how are those available and accessible to the community? Is that through the clinic?
Through the clinics, right? Through MCH, through community health, as well as outreaches from our chronic disease program, and of course, our community health workers.
Thank you. And as a follow-up to that, are we doing deployments into our communities with our health van to be able to reach individuals where they're at?
Commissioner Encarnacion, U.S. Department of Health, yes, sir, we are conducting our outreach on a continuous basis. We also doing some collaboration with VICPO so that we can actually continue doing those outreaches as well. So it's a collaboration.
And I wanted to add to that, Dr. Julia Sheen, Executive Director of the Virgin Islands Diabetes Center of Excellence. We offer a monthly nutrition class that is free to the public. We offer that I think the next one is coming up on the 8th of October. And we also offer a monthly diabetes medication management class. So we do group classes, but we're also providing individual counseling for people that need extra help.
No, we also too, and so that brings to another conversation we had before in terms of collaboration and communication. So I think one of the things that we would look at is pulling the team together to seeing what our strategic goals are so that we can actually join forces, because I think we'd actually expand that program or at least share information so that we're speaking and teaching the same things.
Yes, thank you for that important information. Senator Donna Fred Gregory, you're recognized for your point of information.
Thank you, Mr. Chair. I had a quick question. You spoke about, barriers to access. And I think what's important is us knowing what measures are in place to ensure that residents in our territory, regardless of their financial situation, can receive diabetes screening and treatment. So how are we making that happen? And how are we putting that information out to our community?
So for us, we increase access to care by going out into the community and conducting diabetes screening. That's one way. The second way is through one of our grants. We just purchased a mobile unit where we're going to be going out, bless you, and we're going to be conducting screenings on the van and providing specialty service there as well. In addition, we purchased a 6-passenger ADA-compliant van where we can pick patients up and bring them in to see the doctor, because a lot of our patients don't have transportation. And then for patients that don't have health insurance, we do charge the Medicare rate in our office.
And that happens on St. Croix?
Yes, and it will happen on St. Thomas as well.
So how did you acquire the equipment that you have, i.e. the vans, the equipment period? Because I saw the vans in your testimony, and I was very excited about that. So talk to me a little bit about that.
It's through a grant through HRSA, Health Resources and Services Administration.
And we have the same opportunity here, or have you exhausted, or do we have to go through the Department of Health? That's why I asked about the partnership.
Right. No,
Yes.
it's the same opportunity through that grant.
Uh-huh. Okay. Okay, thank you, Mr. Chair.
Thank you, Senator Fred Gregory. Senator Blyden, you're recognized for your point of information.
Thank you, Mr. Chair. Along those same lines, Dr. Sheen, in your presentation, you have your partnership with the housing community in terms of public housing. And what does that look like and what's being done in those communities?
We haven't been able to facilitate our partnership with housing as yet, but it is something we have reached out to them to partner with them. And what it would look like is us utilizing our van to provide services in the various housing communities.
In respect to the housing communities, and you said you really haven't moved forward with that partnership thus far, but I believe when it comes to the different housing communities, I know they have, for instance, community specialist that actually does outreach also. And also right now they have tenant councils in all of the different housing communities. So if you can coordinate with them and they can provide a space also for you in those different housing centers to assist moving forward. And I think if you meet them where they're at, you're going to go much further and much more people is going to be there to actually receive the services. So I would like to see that happen because that's very important and it's a large population.
I do agree. Thank you.
Thank you so much. Thank you, Mr. Chair.
If I may?
Yes.
Dr. Valman is on St. Croix, and we actually have an excellent program working with the University of the Virgin Islands and on our community health workers. Dr. Valman, can you speak about the program implemented in the housing authority areas?
Good morning, Janice Valmont, Deputy Commissioner. Absolutely, Commissioner. So the Chronic Disease Program partners with the University of the Virgin Islands to conduct a health empowerment program which addresses chronic conditions in individuals in the community. We've been fortunate to partner with the Housing Authority to be able to provide that intervention in the housing communities, both St. Croix and St. Thomas. And in addition to that, our community health workers are part of working with the housing communities, and we have been fortunate to have VIHA Wellness Program partner with us to host our community health workers when they need to do their training. So it's an ongoing and definitely a need that we recognize and plan to continue working with VIHA on that area and others.
And we welcome you as a partnership, Dr. Sheen.
Thank you so much.
Okay.
Thank you. Dr. Valman, I want to follow up quickly. I think one of the senators had asked about the numbers of the incidence of diabetes in 2021, 2022. We wanted to see what the trends are, if the numbers were increasing or they were decreasing. Do you have the numbers comparing 21 or 22? Do you have those numbers, the total diabetes, including pre-diabetics?
I believe I do. Janice Valmont, Deputy Commissioner. And we, just so everyone knows, we do gather this information through the Behavior Risk Factor Surveillance Survey that is conducted annually in the territory. We are very proud of the Chronic Disease Program for doing that. So in 2016, when we resumed the breakfast, we had a percentage of 12.7 who had reported that a doctor had told them they had diabetes. I don't have the actual number. We can calculate those for you. In 2021, it was 14.9%. In 2022, 15.3%. And then 2023, 16.6%. So it's been changing somewhat, so we need more years to be able to really confidently look at any real trends related to the prevalence of diabetes in the population. And as you know, breakfast Behavior Risk Factor Surveillance Survey is a voluntary survey, and we conduct that on a sample of the population. So there will be some variation by year, but we are definitely looking to continue that data collection so we can look at long-term trends. In terms of pre-diabetes, that question was on the 2022 and 2023 breakfast, And for that, we saw actually, as of right now, it's too soon to say trends, but we did see a drop from 2020 to 23 in individuals who said they had prediabetes, and that went from 15.4% to 13.9%. So we are proud of that, but we are cautiously optimistic. We do need to look at more years. And those questions, depending on what year of the survey, because it is a national survey, we continue to anticipate that we will conduct that every year.
Okay, and I know, Dr. Sheen, you have to catch a flight. You have to leave shortly. But so I'll allow one burning question, but I want to follow up because it seems like if you have diabetes or prediabetes, you need to have a glucose meter, a weight scale, and a blood pressure monitor, among other things. What percentage of the persons that present to your clinic have those basic items?
So I refer to those items as part of our remote patient monitoring program that we just recently launched. So we're looking at two different populations. One is our pre-diabetic population, and we've incorporated the remote patient monitoring for those individuals. And they will receive a digital watch. For some of them that have high blood pressure, they'll receive a blood pressure machine, as well as a digital scale, because some of them need to lose weight. And then for those individuals who have diabetes, many of them also have high blood pressure, they'll receive a glucose meter, a digital scale, a digital watch, and a blood pressure machine.
Free?
Yes. It's not free to them because it's being supported by a grant.
Senator, if I may.
Yes.
For the general population, I think what you're doing is absolutely wonderful. It's important also that individuals who are insured by Cigna, if they have 2 or more chronic conditions, they receive some of those as well. Medicare, because they also have the case management program, and they do supply some of those equipment as well. So it's I think that overall, we have access to things that maybe some people outside may not know of.
That's awesome. So it's good news that the persons that have this disease can get assistance getting these tools, these measuring items. So I would allow one burning question. Senator Marvin Blyden, you're recognized for your burning question.
Thank you again, Mr. Chen. I appreciate this hearing. It's very important information and a very important topic. This one will go to CEO Tita Comisión. You gotta mix up with Tita and Tina, Comisión Encarnación. But nonetheless, let me ask you, in respect to the hospital, and we know we have a facility that sells food there and prepares food. Are we basically applying to health qualities, etc., when it comes to diabetes based on the numbers, and that entity preparing and selling food to many of the patients and other folks in the communities? Can you speak to that, please, and what does that look like from a health perspective?
Tina Comisión, CEO for Schneider Regional. Thank you for the question, Senator Blyden. In our cafeteria that's open to the public, we offer healthy food choices. We're very careful about the amount of salt we use in things when we're cooking, et cetera, and sugary things are limited. So we encourage the public to come there for a healthy lunch. We serve appropriate portion sizes, et cetera, making sure you still have enough food and you can save half of it for later. But we try to encourage healthy choices for the public through our cafeteria. For our inpatients, we have very careful diets that are set for them by our clinical dietitian, depending on whatever their condition is and whatever their condition requires. So when you're on the floor, you might not get as tasty food, but it's still good for you and it'll help you get strong and better and out the hospital. So that's the goal. And we want to encourage healthy eating across the population generally. So we do our things like dinner with a doctor, where we do public education. We invite folks to come in once a month, learn about healthy lifestyles, stress reduction, better eating, being more active, et cetera.
Well, again, thank you, all of you, for your responses, and thank you so much for what you do. Mr. Chair, thank you again for the time.
Thank you, Senator Blyden. And you know, I got to thank my colleagues in the 35th legislature, because for these areas, kidney disease, diabetes, we've actually provided a lot of funding. 700,000 for Caribbean Kidney Center. Last year, we just recently provided 2.1 million additional to pay for the staff Pafford Nursing and to Caribbean Kidney Center for supplies. We've appropriated $1 million to Roy Lester Snyder and another $1 million to Wang Louis. So the 35th legislature, I have to thank my colleagues. But we have one further axe in that we also want to make sure that the Virgin Islands Diabetes Center for Excellence is funding. So your number is about 800,000 additional, Julia. What is it, Dr. Sheen? What is it?
That's correct, Senator.
About 800,000 additional. So that would bring it to 1 point what?
I think it's 1.2 million.
1.2 million. Okay. Well, thank you. Thank you. And so I'll allow a 30-second closing. We'll start with you, Dr. Sheen. I know you have one burning. Oh, I'm sorry.
Point of information. What happened to the burning questions to the senators?
Yes. I didn't see the hand raised. You may proceed, Senator Gittins.
The President was here before I yield. Thank you.
Senate President Francis, you may proceed.
Thank you very much, Mr. Chair. My burning question, again, go out to both the Commissioner and Dr. Sheen. In regards, what is the synergy, recognizing the high blood pressure, diabetes, high cholesterol? What is the synergy that's occurring between the public-private laboratories as well as the primary care physicians? How are individuals that may be diagnosed or engaged, how is that getting back into the loop to make sure that we have the continuation of care?
That's all about what we're trying to do in the Office of Health Information Technology under the Office of the Governor, and that's Health Information Exchange. Right now, we're also looking at data warehouse at the Department of Health. AC Malloy is actually managing. So we're trying to develop that collaboration. Right now, I know that a lot of the physicians have access to the pharmacies, the laboratories, the private laboratories also have access to the hospital's laboratory. And of course, the CEO can speak to that as well. We are not there yet where we do have a full HIE, but we have begun the implementation through the Executive Director and the Office of Health Information Exchange. There's a summit coming up soon that would be able to provide, I'm sure you'll be there, provide much more information, but that is something that says that we're well on our way, but not quite there yet.
And for us, we recognize that hypertension and high cholesterol is really significant for our patient population. 68% of our patients have high blood pressure and 41% of them have high cholesterol. And so we're taking a more comprehensive approach in looking at diabetes and high blood pressure and high cholesterol. And we are exploring a partnership right now with a cardiologist so that we can not only monitor those patients and follow up and engage in chronic care management for those individuals, but we want to add another member of our team, which is a cardiologist, to better treat and manage the care of our patients.
Senator, if I may, one of the things that we used to do very well years and years ago is we have family practitioners. So we didn't have as many specialists as we have today. So that one physician actually knew exactly what was going on with that one patient. And I think that what Dr. Sheen actually spoke about is actually doing maybe with several physicians what we did years ago. So that holistic approach to healthcare is something that we do, and we have to ensure that everyone is doing so. And then we have to go back to look at how we're managing that, and that comes into behavioral health as well. How are we managing the psyche that allows them to really listen to what's going on and really learn from reduction of chronic disease, all of the chronic diseases that have just been spoken about.
Thank you, Commissioner. You know, I had my note here, I even forgot it. You know, for the younger residents, you know, community currently contemplating a great career in the health profession, the salaries for a dialysis nurse, specialty dialysis nurse, is about $133,000, and a dialysis patient care technician is about $94,000. So those are some good paying careers in the kidney dialysis industry. Also, we wanted to ask Assistant Commissioner, any comments, anything you wanted to add?
Burning questions. Senator Giddings.
Senator Gittins, you're recognized for your final comments.
Thank you. Thank you, and I'll be quick. I just wanted to say that besides education, healthcare access at times is a challenge, and limited access to preventive healthcare and delayed diagnosis too is a problem. And I want to remind all that stress and discrimination also contributes to diabetes. I wanted to ask, I'm not sure if it's fair to ask the Department of Health, because it should be asked really to the Department of Human Services, but if, just let me know whether or not you're aware if there are any, sorry, there was a feedback. Are you aware if there's any specific regulations on food purchases under our food stamp program to your knowledge?
I know there's some restrictions. I can't say what the restrictions are. Commissioner George and her team would be able to answer better.
Thank you.
Okay, and and lastly, I'll ask you to also work along with the Department of Education. I found where in 2007 the legislature had worked on a bill back then, and I think it was made through Act 6933 that had pulled out all those machines and whatnot from our public schools that were dispensing all those sweet items and whatnot. I just wanted to see if this is being adhered to. I'm not sure if there's a vending machine in any of these areas, but I want to refer you to Act number 6933 and see if that could assist you, Department of Health, in working along with the Department of Education to ensure that we don't drop the ball on this. Diabetes is really killing us. Thank you so much.
Thank you, Vice Chair Gittins. And at this time, we'll entertain a 30-second closing. Dr. Sheen, you may proceed.
Just wanted to thank you so much for providing us the opportunity to share with you our progress thus far, and thank you for considering increasing our funding. We really appreciate that. Thank you to my esteemed colleagues, Commissioner of Health and her team. Thank you for supporting us, for being partners with us in this work, as well as CEO Comisión for partnering with us in providing services to the St. Thomas community. I'd like to thank the VITCO team for all of your hard work and for being a part of this process. Thank you to the community for supporting our efforts as well.
Thank you, Dr. Sheen. Tina Comisión, CEO.
Yes, thank you so much, Senator Fonseca, and thanks to the entire committee for a great discussion today. Thank you for allowing us to be present to express our support for VITCO. I want to give a special thanks to all of the hardworking staff members of Schneider Regional and everyone else who's working in the space of health promotion and taking care of our residents. We're proud to serve with you, and thanks for the opportunity to be here today.
Thank you, Director Comisión, and now the Honorable Tita Encarnación, Commissioner of Health.
You got it right. Good afternoon, everyone. Thank you so much for allowing us to be here today. Really and truly, this has been an awesome opportunity to have a dialogue, to have a conversation, to bring in some of the critical aspects of reduction of chronic disease. One of the things I want to leave and impress upon each other is behavioral health. Take care of yourself mentally, because your mental care actually impacts your physical care as well. a lot of us go through depression and no longer care about what we look like, what we feel like, or really what happens to us. And I think that's one of the areas of it. So collaboration, communication, and of course, bringing all aspects of care into the light. So thank you. This has been awesome.
Thank you, thank you. And I'm so happy that you were able to all come here. And we thank you for your comments. And I know that it's important work that you do. And please continue to serve and provide all of this wonderful health care to the community. And so at this time, the Committee on Health, Hospital, and Human Services will stand in recess for 5 minutes. The Committee on Health, Hospital, and Human Services is back on the record. Madam Clerk, can you read Block 2 into the record?
Block 2, Bill number 35-0289, an act amending Title 27 of the Virgin Islands Code by raising the legal age to purchase tobacco products from 18 to 21 years of age, sponsored by Senator Ray Fonseca. Invited testifiers, the Honorable Justicia Encarnacion, Commissioner, Department of Health, the Honorable Natalie Hodge, Commissioner, Department of Licensing and Consumer Affairs, Dwayne Howell, Executive Director, Access to Racial and Cultural Health Institute, Inc. The ending of Block 2.
Thank you, Madam Clerk. I see that the testifiers are in the well. I'm going to have them, before I ask the Speaker of the bill to introduce the bill, I'm going to do a mic check with the testifiers. Please state your name for the record. Commissioner, Department of Health.
Good afternoon, everyone. Commissioner Justa Encarnacion, VI Department of Health.
Very well. The Honorable Natalie Hodge, Commissioner, Licensing. St. Corey, who is there for licensing and consumer affairs? So there's no one there on behalf of licensing and consumer affairs?
Good afternoon. Yes, good afternoon.
Please.
Morris Graham, Assistant Commissioner, Department of Licensing and Consumer Affairs for Honorable H. Natalie Hodge.
Good afternoon, sir. And for...
Good afternoon. Good afternoon, Geraldine Vaval, General Counsel, DLCA.
Do we have any other testifiers in the well on the island of St. Croix?
Good afternoon, Assistant Commissioner Ruben Malloy, Virgin Islands Department of Health.
Afternoon.
Good afternoon, Deputy Commissioner, Department of Health, Janice Valmond.
Good afternoon, Renan Steele, Deputy Commissioner, Department of Health.
Good afternoon, and thank you. And ED for Cultural Health Institute, Inc. Please do a mic check.
Good afternoon, everyone. Dwayne Howell.
Please recognize the mic of the testifiers here in a well.
Good afternoon, everyone. Dwayne Howell, Executive Director, Access to Racial and Cultural Health Institute.
Good afternoon. Do we have any other testifiers? Please.
Good afternoon, Micah Crawford, Chairperson of the Coalition for Adolescents and Young Adults Health Champions.
Please do that again, please, and bring the mic. We want to hear you loud and clear.
Good afternoon, Micah Crawford, Chairperson for the Coalition of Adolescents and Young Adults Health Champions Project.
Good afternoon.
Good afternoon, Alelia Hans, Chair of our Youth Coalition.
Good afternoon.
Good afternoon, Nicole Cragwell Sims, Assistant Commissioner, Department of Health.
Good afternoon.
Good afternoon, Ty Hunt Caesar, Chief Medical Officer, Department of Health.
Thank you so much. Who introduced it? Bill number 35.0289. Please recognize.
I do, Mr. Chair. And thank you and good afternoon to all my colleagues and all of the distinguished panel that's present today. Mr. Chair, it is with great pleasure I introduce Bill number 35-0289, an act amending Title 27 VI Code by raising the legal age to purchase tobacco products from 18 to 21 years. National data indicates that nearly 95% of adult smokers start smoking before the age of 21. The transition from occasional smoking to regular daily use typically happens between the ages of 18 and 21. While only 46% of smokers become daily users before they reach 18, the majority, 4 out of 5, do so by age 21. Nicotine addiction is particularly strong in adolescents and young adults as their brains are still developing, making them more vulnerable to its effects than adults. Raising the age at which young people first try or begin using tobacco can help reduce the likelihood of nicotine addiction. Smoking and vaping are linked to a variety of cancers, primarily due to the harmful chemicals they introduce into the body. And here are key statistics and facts. Smoking is responsible for about 85 to 90% of lung cancer cases. It is the leading cause of lung cancer, which is the deadliest form of cancer globally. Smoking also contributes to cancers in multiple parts of the body, including the mouth, throat, esophagus, pancreas, bladder, cervix, and kidney. Smokers are 15 to 30 times more likely to develop lung cancer than non-smokers. Vaping and cancer. E-cigarettes contain nicotine and other harmful substances that may contribute to cancer. While long-term studies on vaping are still ongoing, research indicates that vaping-related lung injuries and exposure to chemicals like formaldehyde, formaldehyde, and acrolein could lead to lung damage and potentially cancer. That's a big word, Papa. A study in Proceedings of the National Academy of Sciences found that vaping can cause DNA damage in lung and bladder cells, raising concerns about its carcinogenic potential. Secondhand smoke also increases the risk of lung cancer by 20 to 30% in non-smokers. It also causes cancers of the throat, bladder, and pancreas in individuals exposed over long periods. Survival and cessation. Smoking cessation significantly reduces cancer risks. 10 years after quitting, the risk of lung cancer is reduced by about half compared to a continuing smoker, and the risk continues. Mr. Chairman, it is with great pleasure I present to you Bill number 35-0289 for consideration. Thank you, Mr. Chair.
Thank you so much, Senator Fonseca, for your introduction of Bill number 35-0289. We're going to start with our first testifier, Commissioner Encarnacion from the Department of Health. You may proceed with your testimony.
Thank you, sir. Good day, Honorable Senator Ray Fonseca, Chairperson of the Committee on Health, Hospital, and Human Services, Honorable Senator Kenneth Gittens, Vice Chair, and of course, the Honorable Vice President. My apologies. It's good that we can actually smile. Good afternoon, and all non-committee members and viewing and listening audience. I am Justa Tita Encarnacion, Commissioner of Virginia's Department of Health, and present with me today are Assistant Commissioners Dr. Nicole Cragwell-Sims and Ruben Malloy, Chief Medical Officer Tyhan Caesar, Deputy Commissioner Renan Steele, and Director of Environmental Health Juanson Harris. We are here to provide testimony on Bill number 35-0289, an act amending Title 27 of the Virgin Islands Code by raising the legal age to purchase tobacco products from 18 to the age of 21. Tobacco use remains the leading cause of preventable death and disease in the United States, contributing to approximately 1 in 5 deaths annually. Smoking is responsible for a wide range of health issues, including heart disease, lung cancer, chronic respiratory conditions, and a wide array of mental health disorders, leading to not only personal suffering, but also substantial economic costs for our healthcare system. Young people are particularly vulnerable to the harmful effects of nicotine. Research indicates that 95% of adult smokers began smoking before the age of 21. Adolescents and young adults are critical periods of brain development, and nicotine exposure during this time can have long-lasting negative effects on cognitive function, memory, and attention. In the USVI, like the mainland US, many adult smokers begin using tobacco in their teens. Raising the legal age of 21 would reduce access to high school-aged teens and those in early adulthood. This could lead to a significant reduction to smoking initiation, helping to protect young Virgin Islanders from nicotine addiction. With all the chronic diseases we spoke about, the Virgin Islands has a smaller healthcare infrastructure compared to any U.S. states, so reducing smoking rates would lower the burden on local hospitals and clinics. Fewer tobacco-related illnesses would result in healthier communities and lower long-term healthcare costs. The developing brain of the young people are more vulnerable to nicotine addiction, and starting tobacco use at an earlier age increases the likelihood of long-term dependence. By raising the age limit to 21, the policy would help delay the age at which individuals may start using tobacco, reducing the risk of nicotine addiction in the USVI. In addition to health risks, the Virgin Islands faces financial challenges related to public health spending. Tobacco-related diseases are costly to treat, and reducing smoking rates would translate into significant savings for the territory's healthcare system. Overall, fewer smoking-related health issues would mean lower public healthcare expenditures, as well as reduced costs for families affected by tobacco-related illnesses. The Virgin Islands economy is heavily dependent on tourism, and public health policies play a role in maintaining a positive image. Becoming a jurisdiction that impacts or enacts progressive reputation as a health-conscious destination. This could attract tourists who value wellness and healthy environments. Moreover, the impact on positive behavior cannot be overlooked. Tobacco use is a significant public health issue in many communities, and reducing its prevalence would lead to a healthier population in the Virgin Islands. Raising legal age to purchase tobacco products can send a clear message to the young people that tobacco use is dangerous and should be avoided. Over time, this could shift cultural attitudes towards smoking and make it less socially acceptable, particularly among the youth. In July of 1992, Congress enacted the Alcohol, Drug Abuse, and Mental Health Administration Recognition Act, PL 102-321, which includes an amendment, Section 1926, aimed at decreasing youth access to tobacco. This amendment, named for its sponsor, Congressman Mike Sinar of Oklahoma, requires states, that is, all states, District of Columbia, Puerto Rico, the U.S. Virgin Islands, and 6 specific jurisdictions, to enact and enforce laws prohibiting the sale or distribution of tobacco products to individuals under the age of 18. States must comply with the Sinar Amendment to receive their full substance use prevention, treatment, and recovery services block grant awards. Public Law 11-6-94, signed on December 20, 2019, supersedes this legislation and increased the minimum age for tobacco sales from 18 to 21. Sinar program is managed by the VI Department of Health, responsible for implementing the requirements of the Sinar Amendment. The 2024 Sinar report, completed in November of 2023, showed 4 violations of sales to minors. The vendors found to be non-compliant were reported to DLCA for further action. Effective December 2019, the U.S. passed a federal law raising the minimum age of purchasing tobacco. In a published study evaluating the impact of federal T21 law at the 1-year mark, the law passed in 2019 showed potential to reduce an easy access to tobacco access among adolescents and young adults, and the need to ensure intensified efforts to increase compliance. By raising the age of tobacco purchase to 21, USVI will join other jurisdictions that will have implemented this policy to reduce the impact of tobacco and their population health. Individuals who begin smoking at an early age are more likely to develop severe addictions to nicotine than those who begin later. According to behavior risk factor surveillance surveys conducted in the USVI in 2016, 2021, and 2022, reported prevalence of tobacco use in the adult population has remained historically low at less than 1%. The Youth Risk Behavior Survey conducted in 2018 among middle and high school youth reveals that 6.6% reported trying cigarettes, though only 1.9% reported smoking on at least one day during the previous 30 days. Age at which youth first smoked cigarettes ranged from as low as 8 years old, that's 1.5%, to 17 years old, as less than 1%. Overall, the age most frequently reported for first-time use was 15 or 16 years old, which was at 2.4%, followed by 13 or 14 years old. The Department of Health, with a strong focus on prevention, supports all initiatives and policies that may prevent any shift in trends towards increasing use of tobacco products in youth and adult population. The USVI Tobacco Coalition, a dedicated group of community stakeholders, has consistently advocated for all initiatives and policies aimed at reducing health risks, to include raising the legal age to purchase tobacco products from 18 to 21 as a key strategy to achieve better health outcomes for all in the USVI. The Tobacco Coalition consists of legal experts, individuals from agencies such as the Department of Licensing and Consumers Affairs and the VI Department of Education, nonprofits, community-based organizations, and some retirees who have served in various capacities in public health. Focus areas for the coalition include community engagement and education, secondhand smoking, enforcement of current laws, clinical care, and youth. Coalition initiatives seek to engage with young people across the Virgin Islands as will continue to target the demographics from tobacco use prevention, educational campaigns, and initiatives. In so doing, the Tobacco Coalition supports the goals of the chronic disease and prevention disease within the VI Department of Health, and members are dedicated to creating a healthier Virgin Islands community. Our thanks to Governor Albert Bryan Jr., Lieutenant Governor Tregenza A. Roach, and the members of this body for your steady support in implementing policies aimed at prevention and promoting better health outcomes for people in this territory. The Department of Health, as usual, is committed to reducing health risks, increasing access to quality and equitable health care, and enforcing health standards. Again, thank you for this opportunity to speak on the legal age to purchase tobacco products in the territory. The department continues collaborative efforts with the 35th legislature members. We stand ready to respond to any questions that you may have. Thank you, Senator.
Thank you, Commissioner Justa Tita Encarnacion. Next, we'll receive testimony from Assistant Commissioner Horace Graham. You may proceed with your testimony.
Good afternoon, Honorable Senator Ray Fonseca, Committee Chair, Committee on Health, Hospitals, and Human Services, 35th Legislature of the Virgin Islands, Committee Senators present, non-committee senators present, and the listening and viewing audience. I am Horace Graham, Assistant Commissioner of the Department of Licensing and Consumer Affairs. Present here with me today is General Counsel Geraldine Vaval. Thank you for providing the DLCA with the opportunity to testify before the 35th Legislature on Bill number 35-0289, an act amending Title 27 of the Virgin Islands Code by raising the legal age to purchase tobacco products from 18 to 21 years of age. Out front, the DLCA fully supports this bill for the following reasons. On December 20th, 2019, the President signed legislation amending the Federal Food, Drug, and Cosmetic Act, raising the federal minimum age for the sale of tobacco products from 18 to 21 years, which was lauded as an important step towards keeping tobacco products out of the hand of youth. This legislation, commonly referred to as Tobacco 21 or T21, was recognized as a critical step in keeping tobacco products out of the hands of young people. The law took immediate effect, making it illegal for retailers to sell any tobacco products, including e-cigarettes, to anyone under the age of 21. All 50 states have since adopted the legal age of 21, underscoring the growing acknowledgement of the health risks linked to early tobacco use. Since the enactment of T21, the FDA has conducted compliance checks on businesses across the territory, resulting in some 392 warning letters or citations, some with civil penalties. Amending our local statute to align with federal law will further protect our youth from the dangers of nicotine addiction, help prevent long-term health issues, curb access to tobacco products, and provide economic benefits to the territory. Research shows that adolescents and young adults are especially susceptible to nicotine addiction. Raising the legal purchasing age to 21 will reduce early exposure to tobacco products, thereby preventing long-term addiction and the accompanying health risks. Studies consistently show that smoking is a leading cause of cancer, heart disease, and respiratory illnesses. Reducing tobacco use among young people in the Virgin Islands will lead to a healthier population, lower future healthcare costs, and ultimately benefit the territory as a whole. The potential savings in healthcare costs and improved worker productivity due to better public health outcomes will positively impact the Virgin Islands economy. Additionally, raising the minimum purchasing age will go a long way to helping to reduce availability of tobacco products to teenagers, as many underage users obtained these through older peers. However, with fewer young adults legally able to purchase tobacco products, the access pipeline is narrowed. Under 27 VIC 305B, Section E, the DLCA is responsible for determining the type and size of signage that must be displayed by our licensees. Upon passage or successful passage of Bill 35-0289, DLCA would need to update all official communications and signage requirements to reflect the new age restriction of 21. Additionally, DLCA would ensure that all 248 tobacco retailers and 15 tobacco wholesalers are informed and educated on the updated law to ensure compliance. DLCA would also need to increase its enforcement of efforts to monitor compliance with the new age requirement effectively. We certainly want to thank you for the opportunity to comment on these amendments, and we stand ready to answer any questions this body may have. Thank you.
Thank you, Assistant Commissioner. And now we will have testimony from Dwayne Howell, Executive Director, Access to Racial and Cultural Health Institute.
Thank you. Good afternoon, Honorable Senator Ray Fonseca, Chair of Committee on Health, Hospitals, and Human Services. My name is Dwayne Howell. I am Executive Director of Access to Racial and Cultural Health Institute, or ARCH Institute, as we more commonly say. We are a 501c3 nonprofit organization operating in our 21st year. Our office is based on St. Croix, but we serve and work with adolescents across the territory on emerging health threats. Joining me to testify are Aliyah Hans, Chair of our Youth Coalition, and Micah Crawford, Chair of our Youth Health Equity Project. Both Aliyah and Micah will offer brief testimony in support of Bill number 35-0289, an act amending Title 27 of the Virgin Islands Code by raising the legal age to purchase tobacco products from 18 to 21 years of age. Not only as a registered respiratory therapist and the only certified asthma educator in the territory, but as a public health professional, I applaud and support and show support for Bill number 35-0289. The bill is critical for several reasons. One, it aligns the VI Code with Federal Law Tobacco 21. Two, it demonstrates the territory's commitment to reduce onset of tobacco use among adolescents. And three, it further safeguards adolescents and younger children from purchasing tobacco products in our retail stores, particularly blend or Fanta, the raw tobacco leaf commonly smoked with cannabis. Over the past 18 months, ARCH conducted merchant education to raise awareness of Tobacco 21 law and its superseding the VI Code. We met with merchants, we provided education, we provided age calculators and signs indicating no tobacco sales to person under 21 in accordance to Tobacco 21 law. Despite this effort across the territory, retailers continue to fail compliance checks being conducted by the Federal Drug Administration across the territory. Over the past 6 months, 24 retailers were found in violation of the Tobacco 21 law. 45% were on St. Thomas. The latest compliance check where retailers were found in violation was conducted on July 25th of this year, and that's by FD, right? Many of the retailers indicate the disconnect with VI Code and Tobacco 21 as a reason for selling to persons under 21. In theory, and based on this logic, Bill 35-0289 should hopefully reduce or outright eliminate such confusion. Just this past Monday, September 30th, 2024, FDA new carding rules went into effect. All tobacco retailers are now required to perform an ID check on persons under the age of 30. You may know that before it was 27. Additionally, the new rules also changed the restriction to tobacco vending machines, whereas you can't have a vending machine that's where there's access to people under the age of 21, right? Have free access. And these rules also include tobacco products delivered through vaping devices or hookah, right? And we're also talking about Fanta, right? Over the last several years, ARCH Institute has been raising awareness about Fanta. Culturally, there's a significant perception of risk for cigarette. And if we examine tobacco use across multiple surveys, we'll notice use is relatively low. Last year, I made a decision to substitute the word tobacco with Fanta. Don't even sound correct, but you know what I mean. We used Fanta instead of tobacco, right? That's substitute, yeah. On our core measures survey and received approval from ONDCP evaluators for this change, and it was specifically for our drug-free communities grant. Preliminary data as expected showed an increase in tobacco use. I'll probably argue there wasn't really an increase, but rather there was a language barrier for some, right? Department of Health's tobacco control program is also diligent about language and increasing awareness of Fanta. Right? But I think it's more important to hear from Aliyah and Micah, so at this time I would like to pass it on for the committee to hear their testimony. But I stand ready to engage with the community with any questions anyone have.
Yes, you may proceed.
Good afternoon, Micah Crawford, chairperson for the Adolescents and Youth Adults Health Champions Project.
Speak up a little bit and speak into the mic.
Pick it up.
Yeah, hold it.
Good afternoon, Micah Crawford, chairperson for the Adolescents and Youth Adults Health Champions Project. Good afternoon, Honorable Senator Fonseca, committee members, fellow testifiers, the general public here in the chambers, and the listening and viewing audience. My name is Micah Niger Crawford. Thank you for the invitation to testify in support of Bill 35-0289, an act amending Title 27 of the Virgin Islands Code by raising the legal age to purchase tobacco products from 18 to 21 years of age. I am an alumni of the illustrious Shaw-Tamale High School, holding the title of President of the Shaw-Tamale High School Class of 2024. I am now a freshman at the University of the Virgin Islands, majoring in political science with the intent to minor in public administration. I currently hold the title of Freshman Senator of the Student Government Associations at UVI. I am the chairman, as mentioned before, of the Coalition for Adolescents and Young Adults Health Champions Project under Access to Racial and Cultural Health, ARCH. In the past, I've also held positions such as president of the Hawaiian Student Council, president of the Hawaiian chapter of the Joint Statements of America, section leader of the Rising Stars Youth Steel Orchestra's cello section, and the list continues. I'm not giving you my entire resume to big up myself on Virgin Islands TV. I'm trying to give you context on why I'm here. To inform you, I'm a trusted community navigator. Arch Institute, very big on building our capacity to conduct community prevention work, afforded me the opportunity to realize my roles in these various organizations were much bigger than the titles I held. As a peer educator and more so as a trusted community navigator, my community, teens, are comfortable to share, show, and provide me with insight and other perspectives of the struggles of adolescents growing up here in the Virgin Islands. Among the many things they tell me, I am often made aware of the amount of vapes, e-cigarettes, or even cigarettes that my peers use nearly every day. When I refer to peers, I don't mean people who are solely my age. I'm referring to people who are 3 years younger or 3 years older. That means 17, 16, 15-year-olds are misusing vapes and e-cigarettes on a daily basis. This means 19, 20, 21-year-olds are using vapes and e-cigarettes daily. As you may be aware, the brain fully develops around the age of 25, so early use will have an effect on the brain. Adolescents are intentionally eroding their brain simply because a lack of policy prevents them from doing so. If we examine social determinants of health and the impact on increasing the risk for engagement in underage substance use, we will realize many youths live in substandard housing, lives in poverty, academic achievement overall is average, and many do not receive regular medical checkups. These are real-life factors this committee must also examine as you create new bills and laws and as you allocate funding for impactful and effective community prevention services rooted in population-specific science. Arch Institute, over the last 2 years, have made significant investment in my co-peer educators and I to increase our knowledge on what prevention is and how we plan and implement effective strategies. I have also traveled to multiple CATCA forums and trainings, as well as trainings planned by Arch. Through the various sessions, I've learned about effective prevention strategies to prevent and reduce drug misuse amongst adolescents. These strategies include giving information, providing support, capacity building, addressing barriers, changing consequences, addressing physical design, and what I'm doing now, policy changes. To effectively reduce the percentage of drug misuse in our community, we must utilize a combination of these strategies. It provides a multifaceted approach to tackling drug misuse in our drug-normalized society. Suppose the government is unwilling to contribute to our youth educational infrastructure effectively. In that case, they should at least be willing to contribute to our prevention drug abuse and other risky behaviors in our communities through this proposed amendment I am supportive of. Tangible funding allocation for effective prevention work and supporting healthy prevention workforce development, including youth peer leaders. Thank you for giving my community, adolescents and young adults, a voice to be heard, and for us to collectively, through my testimony, to show support for Bill number 35-0289.
Thank you, Micah Crawford.
Micah
Crawford, M-I-C-A-H. Next, we'll proceed with Aliyah Hans.
Alelia Hans, Chair of the Youth Coalition. Good afternoon, Honorable Senator Fonseca, committee members, fellow testifiers, and the general public here in the chambers, listening and watching the hearing. My name is Alilia Hans, a freshman student attending the Synchro Educational Complex. I am the president of the Drug-Free Coalition of Adolescents and Young Adults, Youth Coalition. KAYA is a program of Access to Racial and Cultural Health Institute. For short, we say ARCH or ARCH Institute. Our mission is to increase the overall quality of life in the USVI, and it starts with the youths. We generally target risky behaviors and focus on protective factors to preventing drug use among teens by sharing information about the effects of abusing drugs and giving them encouraging positive behaviors among teens and their families. I am also co-host of our newly teen talk show premiering in November, along with Michael Piper and Onile Edwards. I have been a member of ARCH for the last 2 years. ARCH provides my peers and I so much opportunities to learn about helping our peers reduce risky behaviors as well as to actually put it into practice. Last October, I had the opportunity to be the lead youth trainer at a 3-day strategic prevention training with youth in South Africa. We guided them in effective planning on how we as youths can spread information about the negative use of tobacco. I was an 8th grader and my fellow youth trainers were in 12th grade and 10th. These are opportunities we are given at ARCH to be leaders. We are supported and we are trained to do our job as peer educators. We are supported and encouraged to make decisions. So this is why I can sit here in front of you to testify. I am a part of other organizations, but none teaches us about the business we are involved in, like how they do at ARCH. Over the last several months, we have been studying the Strategic Prevention Framework. It is a method to deliver effective prevention programs by assessing, planning, and evaluating our work. Over this time, I was able to complete many trainings to build my skills in strategic planning and identifying the root causes in my community. We have also been studying the 7 effective prevention strategies, which includes also looking at policy. We learned about small P, like a rule at school or a rule at home, for example, and big P, like laws. So honestly, this is exciting, and once again, being given the opportunity to practice the things we are learning. Big P policies like Bill number 35-2089 and Act amended Title 27 of the Virgin Islands Code by raising the legal age to purchase tobacco products from age 18 to 21 years of age can have positive effects on reducing the onset of tobacco use among teens. This is because they cannot buy themselves, and not too many of my friends hang out with 21-year-olds, maybe our cousins. But in general, no. So now with this law, it should make it more difficult to get access to the tobacco products, including blend and Frontal leaf. So this is why I'm in support of Bill number 35-0289. As a youth coalition, we target tobacco use because of the significant amount that is generally used in the youth population. More youths ranging in ages 12 to 17 generally use Frontal and marijuana as an escape from their reality. Using tobacco can have a drastic effect on doing daily tasks such as getting through the school day. Considering that the brain isn't fully developed until 25 years of age, using tobacco could interfere with comprehension skills, which I often see occurring. One question I would like to leave the committee with is what happens after this bill passes? How will we provide information and encourage our retailers to consider the physical design of their stores by moving tobacco products from directly behind cashiers in so our youths don't have to easily see the products when they go to buy other items? Thank you. On behalf of our Youth Coalition leadership, Janiqua Weeks, Vice Chair Ray Bellato, Secretary Makila Miller, Historian Nakia Armstrong, and others. Thank you for allowing my peers and I to have a voice here in the chambers of the Legislature of the Virgin Islands.
Thank you, Aliyah Hans, for your testimony. Colleagues, there you have it. Bill number 35-0289. It applies to tobacco, raising the the smoking age, blend, Fanta, all of that included. And we'll go to a round of questioning, 4 minutes. Senator Marvin Blyden, you're recognized for your 4 minutes.
Thank you so much, Mr. Chair, for the time. Good afternoon again to the testifiers, and thank you so much for your testimonies. I want to go directly first, or before I go to the other testifier, I want to go to the Department of the Assistant Commissioner for Licensing and Consumer Affairs. Good afternoon, Assistant Commissioner Graham. Let me ask you, in respect to your testimony, you spoke to, in your testimony, you spoke to the legislation that was amended federally on December 20, 2019, and you spoke to the 392 warnings and letters of citation to the different businesses. What was done in respect to alerting those businesses what occurred and what their responsibilities were? Briefly, can you speak to that, please?
Right, so Horace Graham, Assistant Commissioner, Department of Licensing and Consumer Affairs. The federal government was undertaking those particular engagements. The Department of Licensing and Consumer Affairs was faced with the challenge that the actual law, the local law that we were, that many businesses were abiding by, was indicating that it was 18. What we did initially was we had to separate the notifications because we had both alcohol and tobacco on the same notification, and we had to separate those in anticipation of this type of engagement. So what we have done through our enforcement teams, we have informed them and let them know, hey, listen, this is something that you would have to abide by, and we just anticipated that this occasion would come where we could have the age raised to 21.
Let me ask Executive Director Howell, you guys have done a lot of work in terms of educating and outreach to the different businesses that you stated in your testimony. And I want to commend Alila and Micah for their advocacy and the role they're playing in this endeavor. But let me, Alila asked a question, what happens after the bill passes, because it will pass. And it has a lot to do with enforcement and communication, correct? And E.D. Howell, in that respect, are you going to continue with your advocacy with this new piece of legislation here in the territory to those businesses? And what has the response been from those individuals? Briefly, speak to that.
Yes, Senator. We're going to continue the work that we're doing. We're going to also partner with, we have a very solid partnership with Department of Health, Behavioral Health, and so we do join in merchant outreach with the SINAR program that the Commissioner mentioned. So yeah, I mean, it's something that we're doing. We're going to do it within our resource capacity. And so, yeah, we're standing ready to continue our outreach and awareness.
And Aliyah, you spoke to your trip that you took to South Africa some time ago, and what did you learn, or what have you seen in terms of their young people when it comes to using tobacco product on that side of the world? What was their experience? Briefly, speak to that. And what were you able to give them in terms of educating them in terms of what happened here in the Virgin Islands and America?
While on my trip in South Africa, I was informed of the heavy usage of hookah. We were able to provide them with information like booklets, what's wrong about it, that it shouldn't be used. I also learned that it was heavily used among teens, early teens. We did presentations and we provided events that they could do to put out information within their schools and their community.
Okay, very well. And let me ask one last question, Mr. Chair, to Mika, in respect to his leadership and what he have done in respect to coping with being upfront with something that's very popular with many teens in the territory in terms of blend and vaporing, and how are you handling that in such a small community? And I want to commend you for that, but I just want you to speak to that in terms of your leadership role, what you have been doing, and what your experience have been with your other teen friends and colleagues and family members.
Thank you for the question. It's all about educating your peers on the risks they're doing, like telling them that, hey, it may make you feel good temporarily, but in the long run, you're eroding your brain, you're hurting yourself immensely. And that's really what it's all about. It's about creating social media platforms or campaigns to educate everyone on why they shouldn't be doing tobacco or vaping or using e-cigarettes.
And what has the response been, though? What type of response? What type of response have you been getting? What have you seen in that space?
It's bittersweet. Some people, they are receptive to the information, and then others, they're like, nah, I don't really care. But I think when we invest in it a lot more and actually put towards funding to show live demonstrations or, or create more advanced social media campaigns to educate others, they'll realize that, hey, tobacco is not for them.
Thank you for responses. I didn't have a chance to go to the Department of Health, but nonetheless, I'm sure my colleagues will follow up. And or if we have a burning question, I'll get to the Department of Health. Thank you so much. I think they did a great job. Thank you so much.
Yes, thank you, Senator Blyden. Next, we'll proceed to Vice President. Senator Francis, you're recognized for your 4 minutes. President, sorry. President Francis.
I think him Blyden. Thank you. Thank you very much, Mr. Chair. Don't demote me yet. I still got a couple more months. Thank you. Thank you very much. And thank you to the testifiers on this very important discussion. And I know the contemplation of increasing this age from 18 to 21 have been around for quite some time. And obviously, we are at this juncture in becoming compliant with the other 50 states and DC in, again, standardizing the Tobacco 21 federal regulations. I want to thank Micah and Alila for their testimony and their perspective as useful members of this community in respect to that. Before I go into my questions in regards to this tobacco product, I wanted to ask you, Commissioner, what is the, and this is a question that came in from the public, the suicide hotline number. What is the current hotline number? Is it still the 8988, or do you have an alternate suicide hotline number?
It's still 988, and you press 1 if you're a veteran.
Okay. And also, someone that may be interested in making a referral of someone that may be having a suicidal thoughts, is that the same number that that person will call?
You can, yes. You can also call the VA Department of Health, and we'll get that number so that we can actually put it in here before we close today.
Okay. All right. So obviously, with those questions being posed to us, that means that we need to do some additional PSAs in respect to that. I know I've heard some in the past, and I'm just encouraging that we continue to do that.
Thank you.
We didn't hear much about vaping today, and certainly that is an area that I've also contemplated creating legislation to ban and prevent vaping here in the territory, and it's something that we'll continue to review. Again, looking at some of the national trends as it pertains to vaping. But I wanted to ask you, DLCA, what is the penalty currently in place for, or will be in place for violation of the Tobacco 21?
Horace Graham, Assistant Commissioner, Department of Licensing and Consumer Affairs. The current penalty for those violations rests at about $500. And so we had, between 2023 and 2024, a number of initiatives that we had done. I think that we did like 4 major initiatives that identified those concerns, and I think it was about $500 per violation. Yes.
So you're saying that there were, we were actually penalizing people despite not having the legislation in place?
No, not for the 21. That if they were caught to be selling to minors in accordance with the Virgin Islands Code, that they were penalized.
No, understood. And what is the due process? I think it'll be important for businesses and others to be aware of the due process that afforded them during this consideration of penalty.
Correct. So whenever someone is cited, they always have an opportunity for due process. And I have with me attorney Geraldine Vaval here, and I'd like her to take a shot at that question.
Good afternoon.
Good afternoon.
Geraldine Vaval, General Counsel, DLCA. So, Senator, once a citation is issued, they have 14 days to pay it. On the 15th day, if we realize that they didn't pay it, we actually have them set up to come in for a hearing. We essentially have a citation calendar call, and we bring them in for a hearing. But even before they come in for the hearing, if they pay it, then they're good to go. They don't have to go through with the hearing, because going through the hearing will actually cost them more.
So if the individual business deemed that the citation might have been an error or whatever, they have an opportunity to be able to, grieve the citation before the 14 days, correct?
Yes, Senator. And they have up until the day it's scheduled for a hearing. And even right before the hearing officer gives us 10 or 15 minutes to actually see if we can work out a deal, because once we put on the hearing, they're subject to an additional cost. So we try to work it out with them.
Very well, thank you. Did I hear my time call, Mr. Chair?
Yes, you may follow. You may close up. You may close up.
All right. Thank you. Real quickly, just again going back to Micah and Aliyah, if you could just speak to what is the discussion being had with your peers in regards, again, some of your engagement with your peers as you continue to undertake these preventative information circulating in regards to the whole tobacco 21 use.
Hi, thank you for the question. Micah Crawford, chairperson for the Adolescents and Youth Coalition for Adolescents and Youth Health Champions Project. My peers' response to what are they saying about using tobacco? It's a bittersweet conversation. Like I said before, originally they might be like, oh, okay, that's a cool fact. Like, your brain doesn't develop until 25, so consuming this tobacco really hurts, or it really, has a long-term negative effect. But then others aren't really receptive, or they don't really care, and that's to put it in simple terms, that's really the response from them.
Okay, thank you. Point of information, Senator Blyden.
Thank you, Mr. Chair. My point of information is to DLCA Assistant Commissioner Graham, because he spoke to once this bill is passed, which it will pass, they're going to have to update all of their communications and signing requirements for all 248 tobacco-related businesses in the territory and wholesalers, 15 wholesalers. So my question is, do you have the funding, number one, for that, and number two, do you have the capacity? How will you enforce the new legislation? Do you have the capacity and the amount of enforcement officers to carry forth the legislation? That's my question. Point of information. Thank you, Mr. Chair.
Yes. Assistant Commissioner, you.
Yeah, Horace Graham, Assistant Commissioner, Department of Licensing and Consumer Affairs. The Department of Licensing and Consumer Affairs does have, in its current configuration, the enforcement capacity to do this, to address this measure. We usually work very closely together with the Virgin Islands Department of Health and their enforcement team. And so that partnership or that collaboration actually acts as a force multiplier, and so we work very closely with them. The signage and communication is just it's a matter of making sure that they have the documentation necessary, and that the DLC is prepared to address that.
Thank you, AC Howell. Graham, sorry. Senator Gittins, you're recognized for your 4 minutes.
Thank you, Mr. Chair, and good afternoon to all. Thank you for your testimony, but I especially want to thank the young people who are here with us and encourage them to continue to participate in the process. Now, this legislation does seek to come into compliance with that of the Consolidated Appropriation Act of 2020, which established a new federal minimum age from 18 to 21. However, it establishes a new minimum age of sale for tobacco products. Now, the legislation that I speak signed into law in 2019, but just took effect on September 30th, 2024, tells me that that should have been an education period in between 2020 and 2024. And while I support the measure, especially being on the same wavelength with that of the federal statute, and knowing especially how we benefit from federal funding, it is still my somewhat concern that we're not looking, or that this legislation just solely looks to the sale of the product. But what happened to addressing the underage or even the at-age use of the product? So I'm looking at it from the usage standpoint. This is approaching from the sale standpoint. And sometimes we gotta stop sending mixed feelings, mixed communications as well, while we're trying to promote small businesses and push businesses and whatnot, but yet still we put all these restrictions on the businesses and say, if you don't do this, you don't do that, then we're gonna penalize you. And you heard from the good attorney, if the hearing starts, it's gonna cost you. You know, so I just wanna make sure that as we have this discussion, that we just not solely look at the sale of the product and going after the business owners, but that we also look at the root cause of the problem amongst youngsters as well, if there is. The stats that I think I heard earlier, I'm wondering where did those stats come from? They sound like general stats used from the mainland. Do we have any local statistics here from anyone that's testifying before us that will tell us that we do have a tobacco problem with our local youths here in the U.S. Virgin Islands?
If I may, the
Anyone?
stats, if I may, Senator, the stats that the Department of Health spoke up came from our breakfast as well as our youth surveillance, which was done locally.
They were done locally?
Yes, sir.
All right, thank you for that. So, again, I do support the measure, but just simply raising the age of the sale, again, does not directly address the root cause of the problem that I'm looking at, whereas I'm looking at the usage amongst our young people. I mean, me personally, I don't like smoking. I can't take smoking. I can't take you smoking around me. And I definitely don't want a partner that smokes either.
Senator, this
there are studies that that will also show that our young people will find ways of accessing these tobacco products, regardless of the legal age. So that's the part that we need to look at again. I'm concerned about the usage, because even if we raise it to 21, somebody at 21 can go and purchase it. We do this all the time, even with the alcohol. And adults will go and purchase the alcoholic beverage and go hand it off. So I'm just saying that as we discuss this, let's not leave out the usage part and do that education piece. So again, this too, I will ask the entities before us in your PSAs and whatnot. Let's speak to not only the sale of the tobacco products, but also speak to the usage, how it can harm the body and whatnot. Young people who are still developing and whatnot, getting into these habits. All right, so I'd like to see that holistic approach within the measure that will also speak to education. And again, simply raising the sale of the age may not even be as effective without enforcement happening. And the enforcement mechanism, we just got to do better in the Virgin Islands. Because it seems like everything is a free-for-all around here. How people park, how people drive, how people just fighting in the streets, fighting in the schools, all these things are almost becoming acceptable behavior. So again, as we discuss these measures, put these measures in place, I want to make it clear that education and enforcement will be key to actually making these things effective. All right? But thank you, Mr. Chair, for bringing this forward and bringing us on the same wavelength with that of the federal statute, which was started or signed into law December 2019, but it was through the Consolidation Appropriation Act of 2020. And I do believe that one of the testifiers, I'm not sure if time was called, but one of the testifiers wanted to respond on St. Croix.
Yes, I think Dwayne Howell wanted to respond to you. You may proceed, Dwayne.
Yeah, thank you, Senator. Senator Gettins, just two things. The law, Tobacco 21, went into effect immediately. There was no deferment. The September 30th date is about carding. There's a carding rule where it was you card from persons 27 and younger. That changed to 30. But in terms of data, in our last core measures data, and when you compare the last YRBS, which I think the commissioner spoke and said it was somewhere about 1%.
Right.
In our last core measures data, which was taken this summer, and with us using FUNTA, that number went to 5.2. And so that's a significant increase when you look statistically. So use is there, vaping is there. Senator Novell Francis talked about vaping, and so remember, tobacco can be used in several different formats, whether it's vaping, hookah is becoming more emerging, and so changing the sale is also part of a prevention policy. It's part of prevention, and if you heard Alelia and Micah testify, they talked about 7 different effective strategies, one being policy, and policy must be part of the prevention continuum.
Right, understood. We're on the same page. I'm just saying that while we're having this discussion, I don't want it to just be, I want all of us having this discussion not to just think on just the sale of it, but I also think on the usage part. And I do have the legislative summary before me that not only speaks to the conforming changes of the minimum age of sale for cigarettes, smokeless tobacco, and covered tobacco products from 18 to 21 years of age, but also increasing the minimum age for age verification, as you stated, by means of photographic identification for these products, and even from the under the age of 27, that is, to under the age of 30, and also increasing the minimum age of individuals who may present, present or permitted to enter facilities that maintain vending machines to sell cigarettes, smokeless tobaccos, or covered tobacco products from 18 to 21 years of age, and increasing the minimum age of individuals who may be present or permitted to enter facilities that maintain self-service displays that sell cigarettes or these other products from 18 to 21, with the rule effective date of September 30th, 2024. So that's what I was referring to. But again, I just don't want the conversation to just go about the concern solely of the sale of the product, but rather, additionally, we also need to start educating on the usage of it. We do have the Department of Health here. I know that licensing and consumer will take care of the aspect of the sales, but at the same time, we have the Department of Health here who should be assisting with the education on the use of this product as well. So thank you for that. And the Deputy Commissioner on this end, or Assistant Commissioner, I don't want to demote you. Which one it is? Assistant Commissioner
Yes.
Malloy
Yes.
wanted to respond, if he may.
Yes, thank you. Mr. Graham, AC Graham, you may proceed with your testimony.
Assistant Commissioner from Health first, and then AC Graham.
Good afternoon, Assistant Commissioner Ruben Malloy. Included in Commissioner Encarnacion's testimony was a citation of a study done a year after the 2019 enactment of the federal tobacco T21 law. One of the findings of that study was that even though the law was in place, 83% of persons under the age of 21 were still able to purchase tobacco products. However, based on the information that Assistant Commissioner Graham presented earlier, we're way ahead of that game in terms of monitoring compliance. This goes to your enforcement comments. Over.
AC Graham? Yes.
Attorney, please.
Yeah, Attorney.
It's not a defense. Spouting facts. Good afternoon again. Geraldine Faval, General Counsel, DLCA. So once T21 was enacted, FDA was tasked with enforcement, was tasked with spreading out throughout the United States to do the compliance education. So they took, I think, up to a year to go out and let the businesses know of the new change. When they got here on ground, because they've been here since 2020, so between 2020 and 2024, they have issued 392 warnings and citation with civil penalties. So they were enforcing on their end, and we were enforcing. They were enforcing on their end based on the new law, and we were enforcing based on our law. So enforcement is there.
Excellent, and that's why I said between
Thank you,
2020
Senator
and
Gittins. Senator Gittins, your time was called. Please.
I understand. May I wrap up the conversation
yes,
respectfully,
please?
please?
Wrap up. Yes. Go ahead.
Thank you so
Senator.
much.
Yes, your time was called
And
like
that's
about
why
8 minutes ago. Go ahead, proceed.
Have a good afternoon. Thank you all so much.
Okay. Senator Blyden, you're recognized for your point of information.
Thank you, Mr. Chair. My point of information is in reference to the response from Assistant Commissioner Graham from the last senator when it comes to collaboration with the Department of Health. My question is to the Department of Health and to the Assistant Commissioner for DLCA, what does that collaboration look like? And when, how often do you guys collaborate in respect to what's going on in this space?
Very often, we actually have our Director of Environmental Health sitting in St. Croix also, along with the Assistant Commissioner of DLCA. We collaborate on an ongoing basis. We actually go out together, review, we conduct audits, and we cite individuals, usually goes to DLCA. If there's a health infraction, then Department of Health, Environmental Health also cites. But Director Harris might be able to give you a little bit more explicit information.
Please.
Good afternoon. Wanson Harris, Director of Environmental Health for the Virgin Islands Department of Health. In conjunction to what Commissioner Encarnacion mentioned, from the environmental health side, we plan to...
Oh, please proceed. I'm sorry. We could not see your face. Continue. Sorry about that.
Yeah, on the environmental health side, we plan to do what we call a tobacco collaboration participation with DLCA. By one department, we'll collaborate with Department of Tourism to promote USVI as clean and a smoke-free destination as well. And with planning, with the Department of Planning and Natural Resources, our plan is to have them monitor the marine pollutions and the waste management to track tobacco-related waste as well. Now, with all law enforcement agencies within the territory, we train them up on the new law, how to write the proper citations, what to look for, and have them enforce the new age restriction, and with the University of Virgin Islands to do some research partnerships.
So when was the last time you went out with health in terms of obtaining your objective, number one, and number two? Can we get through the chair listing of the citation in respect to those items that we are speaking to?
Yes, certainly. We certainly will be able to turn to this Assistant Commissioner Graham, Department of Licensing and Consumer Affairs. We will provide the chair, through the chair, we'll provide the listing of citations that we have issued under this tobacco engagement along with the Department of Health.
And when was the last time you went out with the Department of Health to do such?
We go out on a relatively regular basis. With the tobacco specific, I believe it was the latter part of 2023. I'll have to look at the statistics on that, but I believe it's the latter part of 2023.
July 2023.
Yeah. But we enforce together on a number of other initiatives, but the tobacco specific, I believe that we had, I was told 2023, July of 2023.
Thank you, Senator Blyden. Commissioner, I wanted to follow up real quick. That survey that you did, right, particularly between the private and the public schools, I'm interested to find out, do we have statistics on who use these products, the tobacco products, more, the private or the public schools? Do you know?
Dr. Baumann has the statistics, but I'm not quite sure if it was divided into private and public, to be really honest with you. So, Dr. Baumann, do you have that statistics?
Good afternoon, Janice Baumann, Deputy Commissioner. That study was done in the public schools only, Senator Fonseca.
Okay, thank you. Senator Donna Fred Gregory, you're recognized for your 4 minutes.
Okay, thanks. Thank you, Mr. Chair. Let me ask, as far as young adolescents or young men and women here in the Virgin Islands below the 21 and under, do we have any data to show, what level of tobacco use we have within that age group?
We actually do have some, I think it was like 18 to 24. Dr. Vaman, do you want to read those numbers? One of the things, though, Senator, if I may, real quickly, we speak about going into a store and purchasing tobacco or the use of tobacco. A lot of people do not identify Fanta as using tobacco, and that's kind of like where we have to specifically ask, are you using Fanta versus are you smoking cigarettes or using tobacco?
Yeah, so I agree with you that we'll hear from you said you have one on the same thing.
Dr. Valman, do you have that information?
We'll hear from her, but I do agree with you that that's not something that we talk about as tobacco use, but that is the bigger, huger tobacco use we have in the territory. So let me hear from Dr. Valman.
Janice Valman, Deputy Commissioner. So from the Behavior Risk Factor Surveillance Survey for the 18 to 24 age group, that prevalence is relatively low. That's the prevalence that's kind of under 1% as it varies. And it does vary by age group to the point where our highest prevalence is for the age 35 to 44. In youth, when we conducted a youth risk behavior survey, consistently when asked, have you ever tried smoking cigarette, even 1 or 2 puffs, 6.6%, Mr. Howell, yes, that's about right with what you found with your cause study. And then when asked the age, and that's presented in the testimony, they started fairly young, as low as 8th grade, because as 8 years old in their reports, when they responded to the survey. However, when we did ask them about during the past 30 days prior to the survey, 1.9% reported smoking on at least one day. So that would suggest a current smoker of about 1.9%, which again is lower than Mr. Howell found when he added the Fanta question. So there is some need
so what's
to
important for
understand
me?
how-
Thank you for your response. So what's important for me is how do we, because we have the discussions that we have is a lot around the actual cigarette, right? How are we, and this is I guess for licensing and consumer affairs, how are we actually regulating the Fanta purchases in the territory in these small package stores? Or are we?
So,
1 minute.
yes, Horace Graham, Assistant Commissioner, Department of Licensing and Consumer Affairs. Individuals who seek to sell any tobacco product must receive the tobacco retailer's license.
Okay.
And so through that mechanism, we have the assurance that they are aware of the limitations, and those will also be the individuals and entities that we will be informing and ensuring that they do the 21 years or older as the basis for sale. But what we do is the same thing. We make sure that they are licensed and that they are informed. And when we do our investigations and or
And let me just ask
enforcement
you,
activity,
let me
we
ask
address
you,
that.
Let me ask you, you say we do, and we hear a lot of that, but how deliberate are you about what we do?
Time.
Is this something that is part of the regular duties and responsibilities of your enforcement officers? Is there a report that they have to provide every week, every month, et cetera? How do you know? I'm a firm believer in what gets monitored gets done. How do you know, in fact, that your folks that you have on the ground are in fact doing their due diligence deliberately around this particular work?
Yes, Senator, it is not something that is happening on a daily basis, but it's something that certainly, given the new light being shed on this scenario, we certainly will be ramping up enforcement.
So it's not being done? Because it's not
No,
being
it
done.
is being done, and that's why we
I didn't ask
that's why
about
we
a daily
presented.
basis. I was very specific. See, when we answer the questions, let's just be upfront with it. I didn't ask about a daily basis. The question is there a reporting mechanism and how deliberate you are about it? If you're now ramping it up because of the federal law, that is very concerning. So if it's not happening, it's okay to say it's not happening and what mechanisms you have in place to make it happen. But I didn't ask about a daily basis. So again, I'm going to wrap up because my time has been called, but when we move legislation, it's important that we know that there is an implementation, a deliberate implementation mechanisms that has been put in place. We have two young people here, Micah and Adelia. That's Adia? Alilia, that's here with us today, and they need to know when they come before the institution of the legislature and we say yes to measures that in fact is going to be enforced and is going to be a deliberate attempt to ensure that the law is in place and in full force and effect. And I'm going to rest my case there. Thank you, Mr. Chair, for the time. I am in support of this measure, and I will vote at the appropriate time.
Yes, thank you. Thank you, Senator Fred Gregory. Point of information, Senator Blyden, you're recognized.
Thank you so much, Mr. Chair. I mean, I have a lot of points today, but it's important. As my colleague said, we do have young people here who actually are on board and supporting this legislation, and it's important. Let me ask Assistant Commissioner Graham, in respect to what my colleague just spoke of, in respect to it being enforced. And I know we have a lot of individuals throughout the community inside of most of these bars and establishments who smokes hookah all the time, and which is tobacco products. And in terms of enforcement and cigarette smoking, period, in the Virgin Islands, indoors, what's being done in respect to enforcement, and what do the regulations look like, and is there a policy at the department when it comes to speak to that? Can you speak to that, please, Assistant Commissioner Graham?
The enforcement of cigarette smoking in the Department of Licensing and Consumer Affairs in restaurants, really that falls under the Department of Health. However, when we issue a license to individuals, we have what we call a smoker's lounge that was authorized. And so they go through the process of making sure that they get all of the documentation in order, all of the situations clearly outlined for them to be able to operate that kind of business. We do not grant permission for folks to have hookah or cigar smoking within a facility unless they are authorized as a lounge, as a smoker's lounge.
Let me go to the Commissioner of Health, because we need to have clarification. And you said you collaborate with the Department of Health on a regular basis. Can we have some clarification, please? And can you explain to us exactly what's going on in our space and or what needs to be done moving forward? That's what I need to hear. Commissioner?
I think that we're speaking of two things, actually doing an assessment and findings of the assessment, and then what's actually done after the findings are actually put in place. So in terms of accountability, we need to make sure that we're holding those individuals that we're finding things out accountable, and the way we hold them accountable. I think it's okay for them to feel a little bit in terms of their pocket, because if not, then we're actually risking the lives of not only our youth, but adults as well. So I think that that collaboration in terms of working closely with DLCA is important as well. So we'll continue to do so and ensure that we too are not just saying, okay, well, you shouldn't do this again, but hold them accountable, find them on our half, and then submit that to Department of DLCA. We worked with them closely in terms of when COVID was around, and we actually threatened a lot of businesses closure for non-compliance, and I think that's maybe what we'll need to do this time as well.
Very well. I know during COVID you were on point, but nonetheless, with this, moving forward, we also need to be on point. And thank you so much for your responses. Mr. Chair, thank you for your leniency. Thank you so much.
Thank you, Senator Blyden. Okay, at this time, it's no burning questions. I'll entertain. Okay. Yeah. Okay, we will recess. The Committee on Health, Hospital, Human Services will recess for 2 minutes. The Committee on Health, Hospitals, and Human Services is back on the record. Do I hear a motion? Senator Marvin Blyden, you're recognized for your motion on...
Thank you. Thank you, Mr. Chair. Mr. Chair, I move that Bill number 35-0289, an act amending Title 27 of the Virgin Islands Code by raising a legal age to purchase tobacco products from 18 to 21 years of age. I so move.
Second. Bill number 35-0289 has been properly voted, motion by Senator Blyden, second by Senator Donna Fred Gregory. Roll call.
Senator Marvin A. Blyden.
Yes.
Senator Blyden, yay. Senator Diane T. Capehart.
Mike St. Croix, Media.
Senator Diane Capehart.
Yes.
Yes.
Senator Samuel Carrion.
Yes. Yes.
Senator Carrion. Senator Carrion, yay. Senator Ray Fonseca.
Yay.
Senator Fonseca, yay. Senator Novell E. Francis.
Yay.
Senator Francis, yay. Senator Donna A. Fred Gregory.
Yes.
Senator Gregory, yay. Senator Kenneth L. Gittens.
Yes.
Senator Gittens, yay. Senator Maurice C. James. Senator James, absent. Senator Milton E. Potter. Senator Potter, absent. Chairman, we have 7 yea, 2 absent.
Thank you, Madam Clerk. Bill number 35-0289, an act amending Title 27 of the Virgin Islands Code by raising the legal age to purchase tobacco products from 18 to 21 years, has been voted upon favorably by this Committee on Health, Hospital, and Human Services and will be forwarded to the Committee on Rules and Judiciary for further action. So moved. The Committee on Health, Hospital, Human Services. Oh, sorry, I'm sorry. I would allow a 30-second close. I'm sorry. We're going to start on St. Croix with Assistant Commissioner Horace Graham.
Thank you very much, Senator. Thank you for providing the DLCA. We really appreciate the opportunity to testify on this bill. It's been a matter that we have faced with our regulatory activities. Many individuals have been raising the challenge as to why the disparity in the ages. And so we want to thank you for righting this situation, and we continue to redouble our efforts to ensure that enforcement is appropriately done. Thank you again.
Thank you, Commissioner, Assistant Commissioner Graham. We will then have Commissioner Tita Justa Encarnacion.
Good afternoon once again, and thank you for allowing us to be here. I think smoking cessation is something that we hold very near to and dear to our hearts. I have to say that having Micah and Aliyah here made it so much easier for us because we hardly had to speak because they did such an awesome job in really explaining exactly what they do at that age and how they relate to their own. And I think that we should actually have them or someone like them here so that they can actually be a buffer between all of us because they are awesome in what they do and we should be proud of our youth as Virgin Islanders.
Thank you, Commissioner Encarnacion. And we thank you once again for providing this testimony on this very important matter as we continue the business of the people of the Virgin Islands. The committee will stand in recess for 2 minutes. The Committee on Health, Hospitals, and Human Services is back on the record. Madam Clerk, can you read Block 3 into the record?
Block 3, the committee will receive an update on the extent to which the Charlotte Kimmelman's Cancer Institute will provide comprehensive cancer diagnosis and care once operations are restored. Invited testifier, Ms. Tina Commission, Chief Executive Officer, Snyder Regional Medical Center.
Thank you, Madam Clerk. And once again, pleasant good afternoon to the testifiers, Darrell Smalls and Director Commission. I'd like to take this opportunity to share with my colleagues and the viewing audience actual testimony the committee has received from a local lady who is right now living off island, temporarily off island, and she's receiving cancer treatment. And we wanted to protect her identity, but she insists that the people of the Virgin Islands know the level of treatment that she is receiving. And we wanted to make sure that when the Cancer Center, the Charlotte Kindelman Cancer Center, is completed, that we can make sure that we can provide whatever tools, equipment, and staffing that she is receiving so that we can make sure that we're providing quality cancer care. So she is at a facility, a cancer hospital, and the hospital also teams up with a family house and provides lodging for the cancer patients and their family. And a room is only $54 and it will accommodate 4 persons. And if you want a full kitchen, it's $74 and that's per day. There's a boutique and everything is free for the cancer patients only. The wigs, the hats, a free massage, food, drinks, and also all of the information. They also provide a free shuttle to and from the lodging house to the hospital. And the cafeteria, the food is low cost because she says, cancer treatment is very expensive. Her surgery alone costs $89,000. And she's thankful for United Healthcare because they paid most of it, but she still had a small copay. Not a big copay. It was less than $1,000. So anything to alleviate the cost to the patient and caregivers should be a part of the local cancer care plan. So she was diagnosed with a late-stage cancer. And of course, the cancer, the cost of the treatment is very important because unfortunately, some people do not survive due to costs. So anyway, the bottom line is that she's grateful for her United Healthcare plan. And so here is what she had to go through. Phase 1 of 3 phases of her treatment required going twice a month for 6 months. And she was receiving both a chemotherapy and an immunotherapy session. And some of them lasted up to 4 to 5 hours. She was diagnosed with a stage 3 cancer of the gallbladder and the stomach. And they were advanced, so she required this 6-month treatment because she had to shrink the malignant tumors before she can have surgery. Fortunately, she completed phase 1 and her tumors shrunk in size so that she was able to enter phase 2. And phase 2 was the surgery to remove parts of her gallbladder and the stomach that was still cancerous, including the lymph nodes. And she completed phase 2 just 3 weeks ago, And thank the Lord, her cancers were successfully removed. And so now she is into phase 3, which is recovery after the surgery. And last week, a couple days ago, the tubes that she had in her were disconnected, but they weren't all removed. So she's now living in a lodging house, and she now only makes private doctor visits. But she's still required to do a lot of tests, body scans, and everything like that. And so she sends a message to all of us that she's very thankful for all of the friends home that have been praying for her daily. And you know, I got information from Director Tina Comisión that approximately 500 Virgin Islanders receive a new cancer diagnosis every year. This is just the story of one person. And at a minimum, the Committee on Health, Hospitals, and Human Resources, we must ensure that we provide the Roy Lester Snyder Hospital, Charlotte Kinnaman Cancer Center with, at a minimum, a radiation oncologist and other critical staff, to include a new CT simulator, and a linear accelerator. We want to ensure that this new cancer center is state-of-the-art, and we want to reduce the need for many of our families needing to travel off-island for cancer care. So running a successful cancer center requires a diverse team of specialized healthcare professionals and support staff, such as oncologists, surgical oncologists, hematologists, pediatric oncologists, gynecologists, pathologists, radiologists, palliative care specialists, etc., etc. So we wanted to receive the testimony of Charlotte Kinnaman to see where we at and where we need to be so that we can have this care. So at this time, I'd like to do a mic check of the testifiers. We'll start with Mr. Darrell Smalls.
Good afternoon, Darrell Smalls, Executive Director, Territorial Hospital Redevelopment Team.
And we'll proceed to my left.
Good day, Tina Comisión, Chief Executive Officer of Schneider Regional Medical Center.
Good afternoon.
Speak into the mic, please.
Good afternoon. Ajay Gregory, THRT, Territorial Hospital Redevelopment Team, Construction Lead Engineer.
Okay, thank you, and welcome to the chambers of the 35th Legislature, the Earl B. Hartley Hall. Ms. Comisión, you may proceed with your testimony.
Thank you so much. A pleasant good afternoon to Honorable Senator Ray Fonseca, Chairman of the Committee on Health, Hospitals, and Human Services, and to all other senators present, and to the listening and viewing audience. For the record, I'm Attorney Tina Comisión, Chief Executive Officer at Schneider Regional Medical Center, which includes the Charlotte Kimmelman Cancer Institute. I thank this committee for the opportunity to give testimony on plans for future service offerings at the Charlotte Kimmelman Cancer Institute when it reopens. We are absolutely thrilled that our beloved CKCI is on track to reopen by the end of calendar year 2025, so we can resume providing comprehensive cancer care to our community. We are working with the Territorial Hospital Redevelopment Team, some of whom are here with me today, Mr. Darrell Smalls and Mr. Ajay Gregory, and with skilled construction contractors daily to get the center ready to resume treatments for patients right here on island at CKCI by the end of 2025. We have already ordered a new linear accelerator that will provide essential radiation therapy, and we've also ordered other new major medical equipment for the newly reopened CKCI. We are excited that soon we will once again be able to provide world-class, comprehensive cancer treatments right here in the Virgin Islands. We look forward to offering our residents the opportunity to remain home and still get the best possible care during a critical time in their lives.
Oh, excuse me 1 second. We also had online Dr. Alan Fonseca. I just want to do a mic check to make sure you're still there.
Yes, I am here.
Okay, we didn't get a visual on you, just an audio. Proceed, Tina Commission.
Yes, sir. We want our territory's residents to know that when CKCI is back online, we will be providing first-class cancer treatment right here at home. When CKCI reopens, it will be better than ever. We will have expanded educational programming and new treatment and care options with excellently trained clinical care teams and loving support teams. Once CKCI is reopened, we will be able to expand our screening programs, which is critical, as we know how essential early detection is for prognosis and treatment. Even with CKCI currently being closed, Schneider Regional has continued to work to address the need for important cancer screening. We have launched our gastro health clinic about 1 year ago and have since caught many cancers in the early stages, and we were even able to intervene and take care of patients before new cancers formed. We are also currently providing bone marrow biopsies through one of our talented physicians, Dr. Yuri Peterkin, which helps patients identify cancers so they can be treated. We continue to offer inpatient chemotherapy and outpatient infusion therapy for our patients. But having CKCI come back online will add to and strengthen what we are already doing in terms of being able to offer additional cancer screening, diagnostic offerings, blood testing, ancillary services, and cancer treatments. When CKCI reopens, we will be able to offer chemotherapy infusions to treat several different types of cancer, including breast, colorectal, prostate, multiple myeloma, lymphoma, lung, ovarian, uterine, and pancreatic cancer, among others. The new CKCI will have expanded capacity to treat most patients who need chemotherapy. Unfortunately, the sad reality is that since CKCI was originally built, the prevalence of cancer within the territory has increased. And in light of that, we are expanding our capacity within the center to be able to care for more people from the Virgin Islands and the neighboring Caribbean islands who need this cancer care. In the new CKCI, we will be adding additional chemotherapy infusion stations, and we will be adding additional clinic spaces to accommodate this increased demand for care. When CKCI reopens, we will be able to offer new services, including expanded infusion therapy services for rheumatology, and additional services for neurology patients needing antibiotics or iron infusions. We will have expanded hematology services as well that will be available to aid patients who develop benign blood problems because of their treatment regimens. And most importantly, when CKCI reopens, we will be able to provide critical radiation oncology services, which has been unavailable in the territory since the 2017 hurricanes Irma and Maria. Radiation oncology must be administered within a secure vault, and the CKCI building was too damaged during the storms to allow those treatments to continue. In many instances of cancer, such as the one that was recounted by Senator Fonseca today, in addition to needing chemotherapy or surgery, the patient also needs radiation therapy. Right now, we can only provide the chemotherapy and the surgery, not the radiation. And so for the past several years, a lot of patients who have been diagnosed with cancer in the Virgin Islands, who could receive some portion of their treatment locally, such as the surgical oncology component or the medical oncology component, have opted to or have had to go off island in order to get the full complement of care they need in order to treat their condition within one place. Going off island for treatment is very difficult for patients and their families, and it disconnects the person who is affected with cancer from their social network at a critical time in their life when they need that social support the most. Oftentimes, a course of treatment can take longer than 3 months, and this puts an incredible strain on the patient's financial resources. In addition, it is tough to be a house guest leaning on that off-island support for such a long period. So some patients who go away sometimes aren't even able to stay long enough to complete their full course of treatment. The experience of having to go away at such a critical time is heart-wrenching, and we are so thankful that we will be able to change that reality for our patients, friends, and neighbors in the very near future. According to data from the VI Cancer Registry, some of which I'll share in detail at the end of my testimony, prostate cancer and breast cancer are among the more common types of cancer that we see in the Virgin Islands. Prostate cancer used to be a frequently treated type of cancer within the territory, but now a lot of that care is relocating to the mainland. A lot of our breast cancer patients also have had to go off island, since oftentimes people want to do both the surgical and radiation therapy treatments in one location. We anticipate that with the reopening of CKCI, these trends will change and more patients will opt to stay home for their care. Bringing back radiation oncology services will be extremely beneficial for our community, especially for patients with cervical, head, neck, and lung cancer diagnoses. While we do not presently see a lot of cervical cancer diagnoses, these patients that do have it often require getting radiation and chemotherapy concurrently, which is not available here currently. Head, neck, and lung cancers are generally less prevalent in the VI compared to the mainland US due to the less incidence of smoking, which is a good thing, but we do occasionally have these cases as well. We will be able to treat these types of cancers and uterine cancer patients that need radiation once we reopen CKCI. When CKCI reopens, we will also be able to offer pediatric oncology, and we will be able to provide maintenance chemotherapy for conditions like leukemia. It is so important that we offer these cancer treatment services within the territory, as we know there is a portion of the population who is unable to travel off island to get them, either due to their age or to a lack of support or financial resources. And ultimately, they decide to forego treatment and tend to die earlier. We understand the importance of getting a second opinion, and we encourage it. But we know that for most types of cancers, you can stay home where it's comfortable, where you have family and social support, and get treatment as good as you can get anywhere in the United States. Our medical staff is second to none. We will be onboarding additional staff that we need when we reopen the center, and we will be offering a wide range of specialist services in CKCI when we reopen. When we were open prior to the storms, we treated patients with advanced stage cancers who are still alive today, 15 plus years later, and they will tell you about it and testify about how good the care they got at CKCI was. We will be working hard to build CKCI back as the premier cancer center in the region to restore that excellent reputation that we had when we were open years ago. A major part of the cancer experience is having to navigate the healthcare system, often with numerous appointments for treatment and follow-up care with medical providers. Cancer not only impacts your physical health, but also takes a major toll on your mental health and your socioeconomic well-being. It can be a daunting task for anyone, but even more so for those who lack a significant support system. As we know, our territory has an aged community, with many people living by themselves and navigating daily life on their own. With the reopening of CKCI, we've been very thoughtful of that, and we have a plan to include both a patient navigator and a dedicated social worker on staff who will help to offer support to anyone who may need it. We will be asking for financial support from the government and from this body to support the operations of CKCI when it reopens. Large cancer treatment centers in the mainland US have the advantage of being able to negotiate the buying and selling of cancer drugs on a much larger scale and have much more purchasing power than we do. We have a single pharmaceutical supplier mainly who is located in Puerto Rico, and that's where we get the bulk of our medications and treatment drugs from. We will look to expand those options, but we need to be sure that we are able to afford to purchase the first line, most effective drugs that are available in the market to treat our patients, and we will need financial support to accomplish that. Unlike the Royal Leicester Schneider Hospital, CKCI is an outpatient treatment center, and so it's not required in the same way to provide treatment to everyone who is seeking care by law. However, it is our intent to treat all patients that we can. And so for our patients who are self-pay, we will work to be able to get some of the medications they need for free or through promotional programs from pharmaceutical companies. But for those who are undocumented, the challenge is much more significant. Without a social security number, they would not be eligible for some government assistance, and they would not be eligible for a lot of the medication assistance programs. Funding needs to be set aside specifically for patients who live within our territory who will not have any ability to cover their own cost of treatment and who cannot get insurance coverage. This is an essential consideration that must be tackled in advance of the reopening of CKCI. Sustaining the cost of cancer treatment drugs will be the largest challenge to Schneider Regional as we prepare to open and operate Charlotte Kimmelman Cancer Institute. Medicare does not reimburse well, and the Medicaid 340B program currently does not cover the full cost of the drugs, sometimes leaving patients with a payable. If a patient is required to take a combination of drugs, they could easily be looking at a cost of $10,000 to $15,000 per dose. And with several doses frequently required for a course of treatment, that course of treatment could easily total more than $100,000 for the drugs alone. Due to innovation and research, the drugs considered to be more effective and most effective change rapidly, sometimes as often as every year. We must be able to treat patients according to the standard of care. We do not want to be unable to provide the best and most effective options for treatments to our patients. SRMC will also need financial support for the upkeep and maintenance of the radiological equipment that will be necessary to be included in the center that will allow us to detect cancer, and will need support for the staffing of essential positions at CKCI. We do plan to market CKCI to the wider Caribbean community. Medical tourism has proven to be very profitable in other countries, and we hope to be able to take advantage of our status as a U.S. territory and in a very beautiful location to appeal to residents of neighboring islands and even from the U.S. who may want to get treated closer to home or come to get their treatments in paradise. We recognize that there will be a challenge in ensuring payment from all sources. We're confident that we can develop a pathway that will create profits for CKCI and be appealing to the patient. We plan to explore partnerships with the BVI, with Puerto Rico, Anguilla, Antigua, and the Bahamas and other Caribbean islands to be able to treat their patients. Though we want to ensure that as many of our residents can stay close to home should they require cancer treatment, we want the community to recognize that there are certain illnesses that we will not have the capacity to treat due to our size and due to the specialized care that is sometimes required for some more complex cases. And this is not atypical for any small community, even those with comprehensive cancer institutes. Certain cases are just better handled at very large specialized facilities. These include some acute leukemia cases, some bone marrow transplants, and some other specialized cases, especially for patients with multiple myeloma. We do want to assure the community that for everything that can be done here locally, we will do it and we will do it well. We are creating an air bridge to accommodate patients who need to come over to St. Thomas from St. Croix for cancer care. We are currently working with commercial airline companies to start discussions around arranging packages for this purpose to make it as seamless as possible for the patients. We are also exploring options through our foundation for interested donors to be able to support a lodge which would house patients who need to stay overnight in St. Thomas while they receive their care. We appreciate all of our community partners, including CSVI, American Cancer Society, and others who support persons who are affected with cancer, who are currently having to travel off-island for their care. And we appreciate the work that's being done by the Cancer Care Coalition, which I am a proud member of, to improve the detection and treatment of cancer in the VI. We appreciate that the Department of Health has an active tumor registry and is gathering data on cancer incidents from the hospitals, the private physician offices, the labs, and the radiology centers, so we have better data and information to inform our decisions. We look forward to coming back to this committee over the course of the upcoming year to provide regular updates on our progress at CKCI and to keep the public informed about our services as we get closer to our reopening date. A big thank you to all of the hardworking, amazing staff of SRMC and to the providers and medical teams in the community who provide cancer care to our citizens. We are so excited for the real progress that is being made towards reopening CKCI, and we want to thank our territorial and district hospital boards for their support for the reopening of CKCI. We especially thank the entire territorial hospital redevelopment team and its executive director, Mr. Darrell Smalls, who is here with me today, and its construction lead engineer for CKCI, Mr. Ajay Gregory, who is also here with me today, for the excellent work they are doing on this very, very important project for our community. Before I close, I will share some data because I know data helps to drive some of your policy decisions around the USVI cancer burden. So currently we have in excess of 400 Virgin Islands residents that are being diagnosed with invasive cancer every year. And we know that it's the second leading cause of death for Virgin Islanders after cardiovascular disease. About 125 Virgin Islands residents die every year from cancer. In terms of newly diagnosed cases, breast cancer makes up about 41% of those cases, lung cancer about 7%, somewhere between 5 and 7% of those cases. Colorectal cancer is quite high at 11 to 15% of those cases. Hematologic cases make up about 6 to 7%. Pancreatic cancer, a very serious and deadly version of that cancer, is anywhere between 4 and 9% of new cases. Lung cases tend to be low compared to the United States, anywhere between 4 and 10%, now as high as 10%. We're seeing an increase in those cases, especially in the St. Croix district. About 4% stomach cancer, surprisingly almost 18% colorectal cancer. And we really see this, and that was part of why we stood up our gastro health clinic and are now doing very, very important colonoscopy screenings. And we know that prostate cancer is really high in the male population, as high as in excess of 30% of the cases that are diagnosed in men are prostate cancer. So really a heavy burden of cancer within the Virgin Islands, as we see in the mainland too. There's about, out of every 100,000 within the population, we're seeing in excess of 200 patients being diagnosed with prostate cancer and in excess of 100 persons being diagnosed with breast cancer. So what we're doing as healthcare providers with our partners are offering more comprehensive cancer screening and diagnostic services. We're working with evidence-based treatment protocols and working to get first-in-class drugs available for the Virgin Islands. We're providing supportive care services and financial support for cancer patients and survivors. We're participating in multidisciplinary cancer care teams to ensure we're taking care of the whole patient. And we're conducting community outreach and education programs, such as our Dinner with a Doctor event that we do at Shanda Regional to help with cancer prevention and early detection. And so that concludes my testimony today. I'm available to answer any questions, and I'm really glad to have an opportunity to talk about the wonderful development that's happening with CKCI. Thank you.
Thank you, Tina Comisión. And what we have done, because obviously this here requires experts, so we've had Dr. Alan Fonseca do an analysis of what the type of care and the equipment that they provide at a major university in California. So, Dr. Fonseca, can you proceed with your testimony?
Good afternoon. I have to be careful because we just turned afternoon here in Los Angeles. So, Mr. Chairman, other invited guests, Ms. Comisión, in preparation for my talk today, I spoke with Dr. Lee Rosen, who is a clinical professor of medicine.
Excuse me 1 second. You got to provide your name, please, and position.
Alan Fonseca. I am a medical doctor, licensed to practice medicine in St. Thomas and in Los Angeles. In
Proceed.
preparation for my testimony today, I spoke with Dr. Lee Rosen, who is a clinical professor in the Department of Medicine, Division of Hematology and Oncology at UCLA Medical Center, and he's in charge of the Santa Monica Division of the Hematology Oncology Group at UCLA. And Ms. Comisión gave us some very good data in terms of cancer. You know, there are about 5,200 cases of cancer diagnosed every day. And by 2040, that's expected to increase by 49%. And that's well and good, but what's important in the Virgin Islands is, as Ms. Comisión hit it on the nail, is that prostate cancer, even though lung cancer may be the most common form of cancer death in women and men worldwide, prostate cancer is the most common cause of cancer death of men in the Virgin Islands and in the Caribbean. Lung cancer is also very common, but in terms of women, again, breast cancer is the most common worldwide, but in the lung cancer, but in the Virgin Islands and in the Caribbean, breast cancer and cervical cancer are the most common types. Also, there's a high incidence of colorectal cancer and stomach cancer. These are when we're looking at data in terms of in the Caribbean. Now, in terms of diagnosis and the equipment that we need, what's important is we often talk about a PET scan, we talk about CT scans and MRI scans. Well, the difference between a PET scan, MRI, and a CT scan is a PET scan allows us to look at the function on a cellular level, whereas CT scans and MRIs cannot allow us to do that. So we are able to detect early activity of cancer cells due to glycolytic activity, which is the activity at a cellular level after we inject a glycolytic substance into the bloodstream, and then we later do a scan. And the CT scan, unlike the MRI scan, has an acquisition in one plane. It's an axial plane. But if you take small enough slices, which are thin slice CT scans, you can then do reformatted images in all three planes, sagittal, axial, and coronal planes, whereas an MRI scan does acquisition in all three planes. CT scan has long been the standard of care in terms of the diagnostic workup for cancer. You get CT scan of the chest, the abdomen, and the pelvis. MRI is still better in terms of looking at the actual soft tissue type tumors, whereas CT scan is better for looking at the bones. So in terms of what's necessary for a cancer treatment center, Ms. Comisión hit it right on the nail. Again, all these things that she talked about are stuff that are necessary. We need an oncologist. We need a supportive staff. We need social workers. We need psychologists. We need equipment in the sense that we need a source of ionizing radiation for radiation therapy. And for those with thyroid cancer, a type of chemical medication, or in order to get rid of the thyroid cancer. We also need the infusion systems. And now when we look at the different types of infusions for cancers, it's pretty universal. In other words, there may be centers that may be more famous worldwide, and I'm not going to go ahead and name them what's the number 1, 2, or 3, or whatever. That's not important because we're talking about what's important for us in the Virgin Islands. And what's important for us in the Virgin Islands is infusion pumps and infusion center. And it matters little much in terms of the type of tumor we have. The treatment protocols and the clinical trials that are available are pretty much universal, regardless of what the center is, be it you have a center on the mainland or somewhere else in Europe. Those treatment protocols for the different types of cancers are available to the oncologists, and the oncologists that we're going to have in St. Thomas would be able to have access to those. So we're not going to be below what you would get on the mainland. The advantage that we have, I know Senator Fonseca discussed the case about one lady that is being treated off island and her family is able to go to a facility and it's very inexpensive. Well, the nice thing that we have is if we're treating people in St. Thomas, they don't have to go to a nice facility. They can sleep in their own bed. They have their family there, and not just one or two family members that may be able to take a time off and travel with them. They have all their family and their cousins and neighbors and other people that they may have known their entire life that is there with them, and they can interact with them, and they have their culture that's there in St. Thomas. So that's going to be something that's very good. And I'm so happy that the Charlotte Kimmelman Cancer Center is going to be open again. And I'm looking forward to us being able to treat the people of the Virgin Islands, to keep them there in the Virgin Islands, and to have a state-of-the-art facility that's going to be second to none in terms of the equipment, the physicians, and the ancillary staff that's going to give a first-rate facility and first-rate care to the people of the Virgin Islands.
Thank you, Dr. Alan Fonseca, for that update and insight. And it's so good to know that we have almost everything that we will need. So, colleagues, we're going to go to a round of 5 minutes. Senator Marvin Blyden, you're recognized for your 5 minutes.
Thank you so much, Mr. Chair, and good afternoon again, CEO, Commission, Dr. Fonseca, Executive Director Smalls, and Lead Engineer Gregory, and thank you for your testimonies. Of course, when it comes to an update on the plans for our cancer center here in the territory, and it's good to hear what the plans are, but I want to start off quickly with the Executive Director Smalls in respect to the planned opening date, which is the end of 2025. Are we on schedule thus far in respect to all that's going on in that space?
Good afternoon, Senator. Darrell Smalls, Executive Director, Territorial Hospital Redevelopment Team. As CEO Commission stated, we are on target. Our original completion date, we were looking at September. We've had what we call unforeseen circumstances, so we are looking to make sure that we are completed before the end of calendar year 25. I will assure you from a construction standpoint, from the major equipment standpoint, everything is on target to be here on schedule. It is just overcoming any of the unforeseen circumstances that could arise.
And speaking of equipment, and several equipment was stated in terms of what's going to be necessary, and in terms of collaborating, getting those equipment here with all that's going on in that space, what exactly would you say? Because I was told that several equipment have already been ordered, correct, for the facility?
That is correct. We have the project is broken down into multiple solicitations. You have the construction phase, and we also have the equipment phase. So we've already selected a contractor, engaged in a contract, made deposits for the two major pieces of equipment, the linear accelerator as well as the CT that is going to be installed. We already have a delivery schedule, and that's in coordination with the contractor to make sure that the facility is ready. So basically, when that equipment is ordered and it arrives in the territory, the building must be dried in, air conditioning being provided, and a dust-free environment to be able to, for that vendor to then start to install those pieces of equipment. So it's a lot of coordination that is underway.
Exactly. And is there any other specialty equipment that you have to order from early in order to assure that it's here on time?
All of the long lead items have been ordered. The remaining pieces of equipment, if you want to call it, that need to be ordered is what we call minor medical equipment, IT equipment, furnishings, and what have you within the facility. Again, those timelines are all on schedule.
And CEO Condition, you spoke to staffing, specialty doctors, etc. How are you aligning that also in conjunction with equipment and the opening of the facility?
Thank you, Senator Blyden. Tina Comas-Young, CEO for Schneider Regional. We have been already starting to look at and speak with the specialists that we would need to add to the team. We're very fortunate to have excellent medical oncologists already in our territory practicing, and excellent surgeons who do surgical oncology already within our territory, but we need to add radiation oncologists, we need to add physicists, special therapists, and the rest of the care team. And so our CMO, Dr. Rosenberg, is already starting to work on that for us, and we're fully engaged and plan to be ready to go when the center is final. When we cut the ribbon and ready to go, we'll be ready to take care of those patients with the appropriate staff.
You also spoke to the wider Caribbean and working with those individuals and assuring that you market properly. What does that marketing plan look like, number one? And number two, when do you plan to start to market to the wider Caribbean in order to let them know what's going on here and what the options are when it comes to our cancer center here in the Virgin Islands?
1 minute.
Yes, we have already actually started to have some conversations with leaders in the British Virgin Islands about our progress within CKCI and our plans to extend those services to them when they open, including speaking with their national health insurance program and figuring out how we will work on the reimbursement things. We know that many of our neighboring islands don't have their own linear accelerator, and it's a lot easier for their patients to come here than to go to the US mainland or to go as far south as Colombia and other places in South America. So we think it's going to be a very attractive option. We know that a lot of our friends and neighbors in the BVI have family and friends that live here in St. Thomas, and so it'll be easier for them to come down and stay with family or go back and forth on the ferry if they need to do that, and get really world-class treatment very close to home. So we're going to put out a full marketing plan. We plan to work with the Department of Tourism and others on doing that outreach so we could really be a beacon within this part of the Caribbean.
You also spoke to larger cancer center.
Time.
And them being able to buy the drugs in bulk, etc., to help control costs and make sure it's more affordable to their people. Have you reached out to see if you can partner with any of those firms to assure that the drugs here are also affordable? And also, what are you doing in respect to when it comes to your purchasing power, etc.?
Yeah, excellent question, Senator Blyden. And we are actually working to create those relationships so that we can take advantage of partnering with them and maybe, getting some of the benefit of their larger contracts, buying things with them in bulk. And also, it'd be very good for us to develop those relationships with one or more centers so that the specialty care that might be required that we can't provide here, there's an established connection for routing our patients to them. And so those conversations will continue over the next year or so and develop even more. And we certainly will provide those updates as we come before this committee in the future.
And in closing, Mr. Chair, in respect to those patients, those individuals in St. Croix and the partnership you're working with the airlines in terms of bulk tickets, have that started already? And what's their response in respect to that?
We've had some conversations directly with the airline companies. They're very excited. They're willing to work with us on deciding if they're going to offer, for example, a special flight a couple of days a week, like add a flight that would just be to bring the cancer patients back and forth. We've been talking with some of our community nonprofit organizations who are currently funding the off-island care about supporting funding those tickets for inter-island care. They're similarly on board, and we're going to continue to drive those efforts also through our foundation to get support from the community for that process.
Thank you so much for your responses. I want to abuse my time, and I guess I'll get a second round. Thank you so much.
Yes, thank you, Senator Blyden. CEO Commission, I wanted to follow up because I know that in addition to the center, we're going to have to make sure that you have the proper staffing. And I was looking here at the oncologists, right? They have a radiation oncologist, they have a surgical oncologist, they have a hematologist, a pediatric oncologist, gynecologic oncologist, and some of those, the salaries are very high. The radiation is $350,000 to $500,000. The surgical oncologist is $400,000 to $700,000. So, are you going to have to come back to get these positions funded?
Yes, Senator Fonseca, Tina Comisión, Schneider Regional. We are definitely going to need additional support and funding from the GVI to add these additional staff members. I think the radiation oncologist is even more than the amount you quoted in terms of their annual salary. We are fortunate that we already engaged a medical oncologist. We have very talented surgeons that do the surgical oncology. We have a hematologist, pediatric oncologist that we do some engagement with, and we'll have to continue to explore the additional positions that you mentioned. But absolutely, we will need financial support when it's time to reopen CKCI. So I would say that's fiscal year 26. We would need line item support for CKCI.
Okay, so we definitely gonna have to work on that because we don't want to, I think the cost is like about $50 million, Mr. Smalls, more or less, for that Shauna Kinnaman Cancer Center.
Currently, the construction cost is in the neighborhood of about $29 million. And then, of course, now we have the major medical pieces of equipment. So totaling right now, we're probably around $35 million.
35, okay. So yeah, we don't want to spend the 35 and then don't have all of the staffing. I wanted to ask you, Dr. Fonseca, what is the CT simulator and a linear accelerator? What are those? It sounds like my starting motto, but what are those two types of equipment? Are you there? Did you hear me? A CT simulator and a linear accelerator.
Okay. The linear accelerator is what we... Excuse me?
No, go ahead. You may proceed.
Okay. Okay, Alan Fonseca again. The linear accelerator is what we're going to need in order to add the isotopes to the material that we're going to use for the PET scan. And basically, that's absolute necessary equipment in order for us to be able to do the radioactive type of diagnostic testing that we're going to do with the PET scanner. And the CT simulator is just basically just a high-tech CT scan that goes along with the PET scanner.
Okay, so Tina, so let me ask you, here, CEO Tina, I'm sorry. Okay, so also now there's some other positions like a palliative care specialist. I have a list of them. I don't really know, what the specialty is, but there's a pharmacist, there's nurse practitioners, supportive. So it seems like you're going to need a whole bunch of staff, right?
Yes, it takes a full team of talented professionals to care for the cancer patient. We will need social workers, clinical social workers, we'll need pharmacists, we'll need nurse practitioners, we'll need radiation therapists, we'll need a dosimetrist, physicist, and a multitude of other specialists to have a full complement for CKCI. Thankfully, we have, I would say, some of those specialists still in the territory that we've retained since we closed CKCI that have maintained the inpatient oncology care we do right now. But there are some positions that we lost when the center closed that we will have to add back. And you mentioned pharmacy. One of the improvements in the new CKCI is that it has its own pharmacy area within CKCI, and there's an ability to pass the medication directly from the pharmacy area to the infusion clinic. And so there's a number of very thoughtful improvements that have been made in the redesign of the new CKCI.
Okay, that's very important. So can you get to the committee those staffing needs? Because this is very critical, and I know that we want to make sure that you're successful. Because, I got some numbers here on cancer care. Just with the Cigna insurance alone, just Cigna off-island was $12,660,000. That's just the Cigna. That's not the United Healthcare. United Healthcare was an additional $7.3 million. And we're just talking about cancer. And then, of course, the Medicaid was another $2.2 million. We're spending a lot of money, and this is just on off-island cancer care. And I'm sure that, for certain specialties, like you say, we'll still have to do it. But if we can have it where our people are being treated here locally, it'll be a lot more beneficial, and definitely it'll be more cost efficient. So we're going to go to Senator President Norvel Francis. Senator Francis, you're recognized for your 5 minutes.
Thank you very much, Mr. Chair, and thank you to CEO Commission and Dr. Fonseca, as well as Daryl Smalls, for the testimony and dialogue that they have presented here today. As a cancer survivor myself, I'm elated to hear the good news that, in fact, we're on time and on target in respect to getting our CKCI reopened and available for treatment of Virgin Islanders. So I certainly look forward to supporting this in any way possible that we're able to do that. I hear you keep asking them to send a list of stuff that they need here. Now, I don't know where we're getting money from, but certainly I believe that we'll work collectively to address some of the shortfalls that we may be experiencing there. So again, having this conversation about the high rate of cancer patients and being able to have this treatment close to home, I think is essential, and as well as to I hearken to say, what is the next step? Are we on target in respect to all of the finances FEMA provided for the rebuild of the CKCI? Is that also equally on target?
Again, good afternoon, Senator. The funding for the reconstruction efforts is 100% in place. We do not foresee any shortfalls in the funding that's made available for this project.
Absolutely, that's great to hear. What about equipment? FFEs, I know that previously in the discussion with the JFL North, there was a delta in regards to the FFEs, furniture, fixtures, and equipment. Do we see the same situation in this CKCI, or that also is committed for funding?
Fortunately, we were able to identify those equipment needs and major losses in terms of the linear accelerator as well as the CT scan. So we did receive funding for those pieces of equipment that were lost in the hurricane. Any shortfalls that we have of any additional FF&E would come out of the overall project funding that has been provided for this project. So from an equipment standpoint, I'm comfortable of where we are right now.
In equipment, are we also looking at a PET scan and a MRI machine? Is that also equipment that we're pursuing?
Okay, currently, the way how this project started out, what we lost following the hurricane was a linear accelerator and a CT scan. We were limited in the, if you want to call it, the footprint of the existing structure. CEO Commission, as well as the medical staff, of course, they were adamant about adding the PET CT. Within the physical footprint of the Charlotte Kimmelman Cancer Institute, we could not incorporate the PET CT. However, the site that we have for the entire Royal Schneider Hospital, as well as the CT, will facilitate the incorporation of the PET CT. And our plan is to include a PET CT once we get to the point of where we could start to begin the demolition of the existing Roy Schneider Hospital. That would allow the space necessary. We've looked at it from a programmatic standpoint thus far, and we see how that it can work. And we just look forward to that next step. So when we open in 2025, no, we will not have the PET CT or the MRI. However, it is in the program going forward for the overall reconstruction of the Royal Schneider Hospital, as well as the Charlotte Kimmelman Cancer Institute.
Okay. And real quickly, thank you for that, Mr. Smalls. The issue of, can you share with us, Madam CEO, the data that's collected from the cancer registry? Are you using any of that data to help you to determine policy decisions or needs moving forward?
Yes, Senator, we're very thankful to have that data available to us now. We know the information is being extracted from the hospitals, from the private physician offices, from the labs, from the radiology centers. So we're a lot more confident in the data that we have now to manage, and that has helped us. That's helped to inform us about the new layout and design in terms of needing to add 6 additional infusion bays based on the increased incidence of cancers. It's helped us to recognize that we need a separate space for hematology and additional clinic spaces in the back to do pediatric oncology and to respond to other findings that we're having. We know gynecologic cancers are high, so we will have opportunities within CKCI to take care of those patients where we see increased prevalence within our community.
Time.
And Mr. Chair, if I may just wrap up with this final question.
Yes.
In terms of partnership, are you attempting to partner with any other entities, especially, I guess, experts in the field of cancer, to Sloan Memorial, Sloan Kettering, for example? Is there any discussion being had with any of those entities, or is solely self-sufficiency that's being established here with the CKCI?
We are definitely looking for those types of partnerships as we move forward. I think now that we're making great progress and we're closer to a reopening date, those conversations become more real, and that outreach is going to happen, even at a bigger pace, at a more rapid pace. We have already created some relationships with radiation oncologists in Puerto Rico and visited their centers to find out, let's say, if we are impacted by a natural disaster and they are not, if treatment plans could be shared so it's easy for our patients to be relocated there for care. And we would mirror those discussions and have additional discussions with larger oncology centers in the continental United States in case we needed to move in the event of a natural disaster, and to be able to accommodate special care that we can't provide here because our population size doesn't support having that level of technical expertise all the time here. So yes.
Excellent. And also simultaneously, are we also having a discussion with professionals in the field? You've mentioned several of them in your testimony. Are we trying to solicit some of these individuals to actually return home to work, or at least come to CKCI, simultaneously with the timeline that you established for opening of the next, I think in 2025 you have indicated, are you having those discussions with those professional expertise in the field?
Yes, we are. And we actually have 2 radiation oncologists that keep in touch with us pretty regularly, that are excited to hear about the progress and interested in either coming on board in some capacity when we are ready to reopen. And we'll be talking to our colleagues in the States and friends of our medical staff to find persons that are a good fit for our community, that are dedicated to the care that we want to provide, to onboard as part of our team.
Thank you very much for your discussion here. Thank you, Mr. Chair, for the time. I think that medical tourism is definitely something in our future, and that we'll be pursuing here in the Virgin Islands. I look forward to being part of that process. Thank you.
Thank you, Mr. President. Tina, I wanted to follow up because sometimes there's some unexpected costs comes up. I know just a couple weeks ago there's a patient that you had. It's undocumented patient, no insurance. Apparently, they probably hadn't been here for a long time. It was a major bill, major bill. These, these are some of the issues you have. But as far as getting the salaries, right? We, our budget is tight, but we have to make sure that we try to get you funded. So this legislature just approved a contract with Cigna for $226 million. It was an increase of 9.7%, some $19 million. And I know the treatment with the co-pay or the no pay could help the hospitals. So I think the 35th legislature, this committee would like to see what changes we could make to those kinds of documents so that it would bring more revenues into the hospital. So explain to the committee some of the changes that you need. If it also involves VI EquiCare, then let us know.
Sure, Senator Fonseca. So currently the VI EcoCare represents a lot of the private practices and private providers. The hospitals have not seen the benefit of increases under the Cigna contract. And I think that's something that we have to change. It's something we need your support in. The hospital needs to get better rates from Cigna and from the other payers. And we can save money and encourage Virgin Islanders to stay home with their care if we make it easier for them to access care at the hospitals. And there are ways for us to work with the plan that exists for government employees to reduce the patient responsibility if they choose to get their care done here on island, if it's something we provide, and done at the hospital if it's something the hospital provides. And I think that is wise. You have more money circulating within the economy. You better support the hospital that everyone needs. And it's something that I would love your support and the help of this committee with.
Okay, thank you very much. Senator Diane Capehart, you're recognized for your 5 minutes.
Thank you, Mr. Chair. I first want to say thank you for bringing the Schneider Hospital and Ms. Commission here to give us great news on the cancer facility on St. Thomas. I'll always remember the day that I went to do an inspection with DPNR to look at the earth change for the potential of having the Charlotte Killiman Cancer Institute, and St. Croix was going to get the cardiovascular facility on St. Croix. And, you know, back then I questioned, like, why we don't have the cancer registry and you guys on St. Thomas have the cardiovascular center. And that was only because of my heart and my compassion as being an environmentalist and understanding our industries that's more on the south side of the island. Now, I know you may not be able to answer any of my questions, but the people on St. Croix, we have a need for a facility to be on St. Croix. And it's good that we would have an option for St. Thomas as we did in the past and all the good things that I hear. But when you in a position, when you hear individuals who live in a particular area and because of their occupation that there are different kinds of cancer, no matter the age, no matter what the sex is, we are having high numbers. And I just wanted to find out, Ms. Commission, if there's a report that an official report that is even available to the public, to the hospitals, for you to even be able to see the numbers in the territory, because this is real. And right now, there are two people that I know very close to me, one because of occupation and one because of their place of residence, that they are battling mesothelioma. One is battling another cancer. Somebody battling, what's the children, the one that, leukemia. And I really feel like in this position, there's only so much we can do other than provide money. But is there an official report that even the residents can see?
Yes,
are you able to answer that question, Ms. Commission? I know I get passionate when it comes to this.
Yes, Senator Capehart. Tina Commission for Schneider Regional, and I certainly understand your passion about it, and I will do my best to answer your question. I feel you, and I feel for the people that are on St. Croix that are affected with cancer. And I certainly think that there are opportunities as we move forward and develop healthcare facilities in both districts for there to be some level of cancer care available in both districts. I think it makes a lot of sense for us to be able to offer medical oncology on St. Croix as well. I think we want to have infusion stations on St. Croix as well. We don't need to have patients come over from St. Croix for certain services. There are things that can be provided within St. Croix. We're happy to treat everybody from St. Croix, but I'm suggesting that for their quality of life and their ease of getting treatment, it does make sense to have certain oncology services on St. Croix. I think for things like radiation oncology, where you have a very expensive linear
1 minute.
accelerator, and for other very special types of care, in a very small territory as a whole, I understand that you have to be selective, and it doesn't always make sense to have the duplication of services, not just upfronting the cost of the machine, but the maintenance of the machine, the service contracts, the providers that are required, not just the radiation oncologists, but the therapists, the physicists, all the folks that you need to run that. So it might make sense for us to have medical oncology in both places, hematology in both places, but radiation oncology specialized within the center. Maybe certain gynecological options centralized where we have that provider. In the same way that for cardiac care, we understand that St. Croix was initially designed to have the cardiac program, but if you live on St. Thomas and you get a heart attack, there being a cardiac suite on St. Croix doesn't do you much good in the first 30 minutes. So in St. Thomas, we need to have a cath lab, and we need to be able to intervene when it's necessary. And I think the logic goes both ways. And we'll support St. Croix, in their efforts to develop it. We are happy to be a partner in that, and maybe we get bulk ordering of the chemotherapy drugs, and there's ways we can work together to serve the residents in both districts.
Thank you. Mr. Chair, if I just may conclude, and
Yes.
thank you. I'm so glad to hear that, because not only is parity important where we have the both services on both island, because the sickness is just not unique on one island, it's on all three islands, right? So, and it makes things so easier that if we have these facilities, if we're going to have a cancer treatment center on St. Thomas, that when individuals travel from St. Croix to St. Thomas, the facility that and family members that would be able to come and stay with them comfortably, all of these things is what we have to think about as we are working on improving the quality of service for the people of the Virgin Islands. Thank you for all that you do. I hope that we would have the continued expansion for both islands, for all three islands. Thank you, Mr. Chair, for having this meeting.
Thank you, Senator Caput. Tina, I want to follow up. You said so over 400 Virgin Islanders are diagnosed with some form of cancer every year. And unfortunately, about 125 die. So that's more than 25%. So do you have information of Virgin Islanders being diagnosed in the early or late stages of cancer? And if it's late stage, why is that?
Yes, Senator Fonseca. I think that information is available through the VI Cancer Registry that's maintained by the Department of Health. Anecdotally, I know that we have to do a better job at screening and early detection. Some of the stats I have around that are, let's say, for example, women who are over 40 years who should have an annual mammogram. Only 62% of us are getting it. And that's not high enough. We obviously are missing folks with cancers we could catch. The same thing for cervical screening. Women 21 to 64, this is Virgin Islands stats. 21 to 64 who should have a cervical screening, only 50% are having that. And for men who need colorectal, adults, not even just men and women, 45 and older, you should have colorectal screening. You need to have a colonoscopy at least once. And then, as recommended based on the first one, we're only seeing 56% of adults over 45 in our territory getting that. So we know we are missing opportunities to catch things early, and that has a big impact on how well or poor you do is when you catch the cancer, and it has a lot to do with how expensive the treatment is. So we need to do more screening, and we look forward to being able to do that when we reopen the center. And I think education on these important health topics are super important, and so even right now, before the center is open, there's a lot that we can do to educate the public about ways to take care of themselves and get their screening and have healthy living, healthy lifestyles to reduce the incidence of cancer within the territory.
Okay, that's so good. So just for my clarification, so breast cancer, lung cancer, colon cancer, and pancreatic and prostate cancer, we will be able to do surgeries on all of those cancers in the Roy Lester Snyder Hospital?
Yes, Senator, that's correct.
Okay, so the operating room now, I think I had Dr. Alan Fonseca do an analysis of the operating room in the Roy Lester Snyder Hospital. So give us your comments on your insights of the operating room and things that may be needed, or just give us your comments on the status of the operating room. Dr. Fonseca, you there?
Yeah, I'm here. Unfortunately, I am driving or being driven.
Okay, I know you had a plane to catch.
I was at this was supposed to start like 2.5 hours, so I have a plane to catch at LAX, so I have someone driving me there. But in terms of the facility, number one, we have first-rate surgeons in the Virgin Islands. Dr. Ulam, Dr. Comisión, the other physicians we have there, and our hospital facility is very good. Our OR is not lacking in anything. We have good lighting, we have the tables, we have everything that would be necessary in order to adequately, without cutting corners, take care of these surgical procedures. I have no doubt that our hospital is definitely equipped to handle the procedure. And as with any procedure, you can have all the equipment in the world. You need first-rate doctors. And that's something that we have. We have first-rate surgeons in the Virgin Islands. And that's the most important thing.
Well, thank you very much. It's good to know. And, I always say that, Virgin Islanders, we're the best of everything. Anything you look at, Virgin Islands is the best of everything. So it seems like we need to just be able to provide the additional equipment and additional staff and any other things that comes up. Make sure that you're billing, the amount that you can bill for the insurance, and that would be a big help to make sure that you succeed. So now one other thing now, as far as you heard testimony that they had the store and they provided the wigs and all of that stuff. So are we going to be, do we have that in the plans?
Yes, Senator. We have an appearance boutique where we have wings and prosthetic devices, the specialty bras and other, garments, the specialty stockings and other things that you would need if you're affected with cancer. I love the idea of it being free of charge for patients affected with cancer. Before, the boutique was reduced cost, but you still had to pay something if you were affected. But I think that's a great project for our foundation to take up, getting folks that do have the ability to give back, to support and offset the costs of the appearance center so that people that are affected with cancer have the opportunity to get those supportive devices and appearance items free of charge to them. I love that idea.
Okay, great. I think that's wonderful. So it seems like folks, we're doing pretty good. We're getting there. Mr. Smalls gave us testimony that around by December of 2025, we should be to a substantial completion point. Point of information, Senator Marvin Blyden.
Thank you, Mr. Chair. And I'm hearing all of the numbers in terms of care when it comes to cancer. And let me ask, though, in respect to the other side, educating, screening, promoting. So let me ask, what's the cost of, for instance, a screening? Number one. Number two, how much is being spent in respect to educating and promoting when it comes to what's necessary and what needs to be done to assure that you are doing what needs to be done in order not to get there when it comes to your health. Can we speak to that, please? Because
Sure,
it's
Senator
much
Blyden,
less
thank you.
upfront than
It's a lot less upfront, and we have to work with our partners who get specific grant and funding for that to help us to spread the message so that we have less patients coming to us needing that advanced care. I think the Department of Health has a big role in that, and they already do a good bit of health promotion activities, but we have to expound on that. And there's a number of other centers and entities, Cancer Support VI being one that just comes to mind. There are a lot of entities out there that can help us with that health promotion and run screening activities. When we reopen, we're going to have a very nice auditorium back again, and that's a place where we can have educational events for the community. At Schneider, we've started a monthly Dinner with a Doc series where we always talk about a different part of healthcare and taking better care of yourself to avoid things like getting cancer. So we have to continue to invest money in the upfront education and put a little money towards screening. The good thing is a lot of the health insurance products do cover the cost of the screening exam. So if you need a mammogram, most insurance companies will cover that. There's very little, if any, out of pocket. The same thing for a screening colonoscopy. It's free to you out of pocket. Now, if they're doing the screening colonoscopy and they find something and they find polyps and they remove polyps, it changes, and then now that's a diagnostic colonoscopy. And so for that, there is an outpatient, out-of-pocket component, and there are ways for us to work with the health plans to even get those things covered, because you might walk in thinking this is going to be free and it should be covered, and learn that it turned into a billable event. We have to work to make it easier for patients to get the screening they need so that we can diagnose cancer earlier and have better treatment outcomes.
And I believe it's important, though, also to add, during your testimony at the end, you gave some data, some statistics that was not in the testimony. And we found out that 125 people die every year because of cancer. If that information can get out, people will understand, wow, I really need to go for my checkup because I didn't notice.
Yeah.
I didn't understand, what's going on within my space. I think that's very important because it actually wakes you up and gives you a reality check in that respect. So I think that's important that information gets out there. When folks know, they respond differently. I believe so. And thank you again for your response, Ethan. Thank you, Mr. Chair.
Yes, thank you, Senator Blyden. And I'd like to follow up on that with the prevention, et cetera, because you gave testimony that with breast cancer, 62 or something like that percent was, screened. That means 30-something% was not screened. And then for prostate cancer, I think you said about 50% of the men were screened, and that means that 50% was not. Well, Sapopa, I think I in the other 50% because I have never had a prostate exam. You got to, it's not good at all. You got to put yourself in that mentality,
Book your appointment this week. You need to go.
Me and Senator Blyden, we're going together.
Okay, good. That's right. Take a friend. Talk to somebody. We need our men to come for their screening and to get their checkups regularly. So get a buddy and make your appointment together.
Yes.
We're happy to take care of it.
And that's the same testimony we heard earlier this morning about the diabetes and the blood pressure and all this stuff. Ladies and gentlemen of the Virgin Islands, we have a responsibility, and I do too, to make sure that we put a little bit more priority to our health care because, it's us that we're talking about, and if there's certain things like diabetes, which is easily preventable to the most part, unless it's a type 1 diabetes, we should be able to do better with the screening. I know the health department works hard, but it seems like we still have to be able to do a better job. So,
excuse me, Senator, if I may.
Yes, proceed.
I just wanted to provide some information relative to Senator Capehart. I have the distinct advantage of being the executive director of the redevelopment team. And in speaking with Governor Juan F. Louis Hospital, I just want to assure the listening audience that within the plans for the Juan Louis Hospital, there is an infusion suite. so that we will be able to provide that type of care on the island of St. Croix. Of course, it comes down to the clinical staff, but one thing for sure, in our new facilities that are being constructed, we're trying to provide all the opportunities across the territory that treatment can be provided in each district. And along the lines of also with the question that we asked about the operating rooms and what have you, all of our new facilities are going to have state-of-the-art facilities to provide care for the patients that will need it here in the Virgin Islands.
Thank you. Mr. Donaldson, engineer, you had any additional comments to add?
Well, what I was just going to add before I was going to add to that is we did provide some information to the media. I'm not sure if they have it, but if they have it, the opportunity to queue it up, this would be where Mr. Gregory, who's the lead engineer on this project, and he could kind of walk you through on the progress that we've made on this Charlotte Kimmelman Cancer Institute, and he's up boots on the ground on a daily basis. So I'm not sure if media has had the chance to get that, but we would love to be able to share that with the community, the hard work that we're doing.
Okay, well, thank you. Miss, any comments? Any additional comments? Okay.
Want to queue up the slideshow?
Yes.
If you can queue up the slideshow, Senator Fonseca, I think it would be great for people to be able to
yes.
see and hear from Mr.
Media,
Gregory.
Media, it didn't come true? Okay, sorry, we're not able to present.
You can release it afterwards. Look on Schneider Regional's Facebook page. We'll post the slideshow and have some Mr. Gregory put some comments there so you can see for yourself the progress that's being made.
Okay, good. So, as we close today's session, we're going to now allow a 30-second close. Tina, you may proceed with your close.
Sure. Thanks again for...
CEO Commission. Sorry.
Thank you. Thanks again for the opportunity to be here to present to you and to the VI public all the great work that's happening with the redevelopment of Charlotte Kimmelman Cancer Institute. As I said earlier, we are ecstatic that we are at this part, in the process, and I really want to thank our THRT partners for getting us here, for all the work they did to get the FEMA determination together so we had enough money to do what we needed to do to build a state-of-the-art cancer institute, and to Mr. Gregory and his team, who's keeping the construction schedule on track so that we're able to treat our first patient by 2025. I want to thank all the hardworking staff at Schneider Regional who provide not only cancer care, but lots of different types of care every day to our community, and to the outpatient providers who have really stepped up and kept medical oncology going and surgical oncology going, even in the absence of having CKCI formally opened. So I look forward to continued progress in this, and I'm thankful for the work that the VI Cancer Coalition is doing, and all of the nonprofits that stand together to support persons affected with cancer in our community. So thank you very much to the committee, and I hope everyone has a blessed day.
Thank you, CEO Commission. And I'd like to thank my colleagues and all of the testifiers, the central staff, and my staff for their hard work and dedication to putting this meeting together. The discussions we had today were crucial to address the diabetes, kidney disease, and cancer challenges facing our community. I urge my colleagues to support the Virgin Islands Diabetes Center for Excellence. I think they need about $800,000. We also, the committee, approved Bill number 35-0289 to raise the legal age for purchasing tobacco and tobacco products. These efforts will undoubtedly contribute to improving public health, particularly in protecting our youth and helping to prevent addiction, smoking addiction. Additionally, we're so proud to receive this update on the Charlotte Kimmelman Cancer Center. This definitely is an upswing, and we see that we will have better cancer care shortly in our territory. And thanks to all once again for your time and contributions, and may we continue to work together for the health and well-being of the people of the Virgin Islands And may God bless us all, and may God continue to bless the Virgin Islands. And thank you. And the Committee on Health, Hospitals, and Human Services is adjourned.